the Joint Standing Committee of Health and Human Services. We'll be hearing one bill this morning and then later on today going into work sessions on several others. The bill we'll hear this morning is LD 1392. If you'd like to watch as well as listen, you can go to legislature.maine.gov, look up under committees for Health and Human Services, and there's a link there that'll take you to our very own YouTube channel. And you can watch past proceedings or current proceedings. We guarantee that there'll be some technical glitches today. We've been 100% accurate on that prediction for the last several weeks, so please be patient with us as we continue to try and deal with those issues. I'd ask the committee leave their cell phones on mute, and we're not using the chat for anything other than to keep the committee work moving ahead. We'll be hearing from members of the public today. Everybody will be getting 3 minutes to present their testimony, and there'll be a warning at 30 seconds. 3 minutes is about a page and a half of typed material. Mostly we want to hear from you. You may get some clarifying questions from members of the committee as we go through your testimony. So let's go around and introduce ourselves, and we'll start with Representative Zager.
Thank you, Mr. Chair. Good morning, everyone. My name is Sam Zager. I represent District 41 in Portland.
Representative Lemlin.
Good morning, everyone. I'm Michael Lemlin. I represent District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Stover.
Good morning. My name is Holly Stover. I represent House District 89, including the towns of Boothbay, Boothbay Harbor, Southport, Edgecombe, Westport Island, and part of South Bristol.
Senator Baldacci.
Good morning. I'm Joe Baldacci. I'm from State Senate District 9, which is the city of Bangor and the town of Herman. Thanks.
Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Bering, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
And Representative Madigan.
Thank you, Mr. Chair. Good morning. My name's Colleen Madigan, and I represent House District 110, which is part of Waterville and part of Oakland.
Representative Meyer.
Thank you, Mr. Chair. Good morning. Welcome to everyone who's joined us today. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is all of Elliott and parts of Kittery and South Berwick.
And I'm Ned Claxton. I represent Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. We're ably supported every day by our staff, although we have some new folks, a new person with us today. Let's start with the introduction with you, Ms. Dooling.
Good morning. My name is Erin Dooling. I'm one of the legislative analysts with the Office of Policy and Legal Analysis. You are going to be assisted this morning by our fabulous researcher, Kristen Braun, also from our nonpartisan office. So I'll be logging off, but you're in good hands with her.
Yeah, we're having trouble with your audio too. So Kristen Braun, want to introduce yourself?
Sure. Good morning. My name is Kristen Braun. As Aaron said, I am a researcher and I provide research support to the Health and Human Services Committee. And I'm with the Office of Policy and Legal Analysis.
Thank you for being here.
Thank
Carrie
you.
Withy is here too.
Good morning. My name is Carrie Withy. I'm the clerk for the Health and Human Services Committee. If you need any assistance during the hearing this morning, you can email me at hhs@legislature.maine.gov.
And you'll notice that several members of the committee are absent, with it being really a pressure-packed full schedule these days in the legislature. People are often called in multiple different directions. So you'll see some people moving in and out, and we'll be joined later on by other members of the committee. So with that in mind, and there being no other business, why don't we move to a presentation of Bill 1392. And as I understand it, Representative Gramlich is here with us to do that presentation. Welcome, Representative Gramlich. We're ready when you are.
Thank you, Senator. It's always a little dizzying going through the cyber wormhole. For some reason, the last couple times I was before you all, I had my video didn't come on, and I'm finding that again. Let me see if I can try something else here. Bear with me.
And I'll remind people that I mentioned the technical difficulties guaranteed, so we can check that box for this morning. Welcome.
Happy to oblige. Well, good morning. Thank you, Senator Claxton and Representative Meyer and distinguished colleagues of the Joint Standing Committee on Health and Human Services. I am Lori Gramlich, and I represent House District 13, which is the lovely seaside community of Old Orchard Beach. I am pleased today to present LD 1392, an act directing the Maine Center for Disease Control and Prevention to release annually public health data regarding certain fatalities and hospitalizations. Normally, when I come before this committee with proposed legislation, I try to do so with data and with statistics to support such proposed legislation. In this case, however, data is exactly what this bill seeks. The intent of LD 1392 is to require the Maine Center for Disease Control and Prevention, in collaboration with the Commissioner of Public Safety, to release an annual report of public health data concerning firearm fatalities and injuries in the state of Maine. This report would be made annually to the legislature and would be public. Specifically, the information in this annual report would include public health data concerning firearm fatalities in the state, separated by the number of homicides, including the number of homicides that were the number of homicides that were the result of domestic violence, further separated by the ages of the victims for each. It would also include the number of suicides, further separated by the ages of the victims, the number of accidents, further separated by the ages of the victims, and the type, make, and model of the firearm used in the above described incidents. Additionally, data in this report would also include accidents and hospitalizations that did not result in death, but by which an injury was sustained. This information also would include the type, make, and model of the firearm used. This bill is needed because currently this information is not found elsewhere. Presently, there is no central location to obtain all of this data. This bill, again, requires the Department of Health and Human Services to only report the data, which exists elsewhere in a single report, and for the legislature and the public to receive it, very much like the annual report that we all receive on opioid deaths in Maine, which we have been receiving for a number of years. And I had been doing a little bit of research. I don't recall if that opioid report was the genesis of which was a result of an executive order, or if it was proposed legislatively. Nonetheless, we've been able to get that report annually, and this proposed legislation would be operating in that same kind of vein. Publishing this information in an annual report would be helpful to inform the public about Maine's pervasive but underreported gun violence problem by bringing attention to the issue of gun violence in Maine. Now, we've all heard the narrative that we don't have a gun violence problem in Maine, a narrative which may be due to the fact that gun deaths and injuries are not the result of street encounters that we hear about on the news, but are rather the result of behind closed door cases like suicides, accidental shootings, and sadly, domestic violence homicides. Tragedies that don't always make media headlines, but are nonetheless significant and impactful. Further, this bill will assist in developing a sensible approach to gun safety by examining the gun violence crisis in Maine and developing solutions from a public health perspective. It is my intent and hope that the publication of this report will draw attention to firearm injury and death, which in my opinion is a public health issue that requires our attention. Appreciate your time and your consideration, and I urge you to vote ought to pass for this critically important legislation. Thank you very much. I would be happy to try to answer any questions for you.
Are there any questions for Representative Gramlich? Thank you for bringing this bill forward. As is our tradition, we then ask to hear from other legislators in support. We'll eventually go to others testifying in support. That's usually done by alphabetical first name. So we'll get to everybody who wants a chance to testify. So now we can welcome Representative Duder and hear from her when you unmute.
Hi there. I guess I have to figure out to get my video going too. Here we go. Yay. All right. Let me get
Thumbs up.
Perfect. Greetings, Senator Claxton, Representative Meyer, members of the Health and Human Services Committee. I'm Representative Vicky Dudera. I represent House District 94, the towns of Camden, Islesboro, and Rockport. I'm here as a co-sponsor to speak in favor of LD 1392, an act directing the Maine Center for Disease Control and Prevention to release annually public health data regarding certain fatalities and hospitalizations. Data is how we make intelligent policy decisions. It brings efficiency and effectiveness in the strategic decision-making process, helps us determine how to best solve problems in our state, optimize our resources, and reduce costs. Data brings accuracy and accountability. It tells us if a policy is working or not working, or whether it is in fact still needed. Here in Maine, we lack data around a critical problem that is growing in our state, and that is the issue of gun violence. Gun deaths in Maine increased 45% from 2010 to 2019, a vastly higher rate than the 17% increase nationwide during the same time period. In 2019, Maine's firearm mortality rate as a percentage of our population was higher than every other New England state. In Maine, the rate of gun suicide increased 50% from 2010 to 2019, compared to a 13% increase nationwide. The statistics I just cited come from organizations like Everytown for Gun Safety, which has a website called Every Stat, designed for users to better understand how gun violence impacts the communities that they care about. But because we're such a sparsely populated state, Every Stat's data for Maine is lacking. And because we don't track this information. Those of us working to stem the tide of firearm death in Maine do the best that we can with what data is available. But gun violence is an urgent, complex, and multifaceted problem. It requires evidence-based, multifaceted solutions. It requires more data. Please support 1392 to give all of us the tools to truly help solve this pressing issue, which affects Mainers of all ages. Thank you. I'm happy to answer any questions.
Thank you. Are there any questions of Representative Dudera? I'm not seeing any. Thank you for being here. So we'll welcome in Representative Zager, who's already here.
Thank you, Mr. Chair. Good morning, Senator Claxton and Representative Meyer and my distinguished colleagues on HHS. I am indeed, for the record, Sam Zager. I'm honored to represent District 41 in Portland. I'm a co-sponsor in this bill and I'm speaking in favor. LD 1392 proposes to amend Title 22, Section 20, which defines the scope of the CDC Director's annual report. Statute already requires the Director to report to this committee on the, quote, challenges and threats to the health of the residents of the state. This bill would add public health data concerning firearms fatalities to that scope, as Representative Gramlich introduced. I submit that anything that has the potential to kill a Mainer qualifies as a threat to health, whether it be a novel coronavirus, tobacco use, hypertension, or a firearm. Some might say, wait a minute, guns don't kill people, people do. The same could be said of motor vehicles. And when we applied a public health lens and public health interventions in this country decades ago, motor vehicle deaths dropped by a lot. For the first 7 decades or so after the Ford Model T was introduced, there was an awareness that we in this country were suffering increased numbers of motor vehicle deaths. We didn't know the details though. And for all people knew, it was a known hazard that couldn't be mitigated. And even if it hypothetically could be mitigated, wouldn't mitigation simply punish law-abiding motorists who were simply exercising their rights? By the 1970s, tens of thousands of Americans were dying on the roads, and enough people supposed that something could be done about it without infringing on rights. And in 1975, the US government started collecting data, just as proposed in LD 1392. The numbers were indeed sobering: 44,000 American deaths in 1975, rising to 51,000 per year by the decade's end, just a few years later. For reference, in 1 year, that's almost as many people as Americans died as in the entire Vietnam War. Then in the 1980s, public health interventions, such as raising awareness about drunk driving, helped turn the tide. Deaths precipitously dropped, and I'll call your attention to a graph at the bottom of the testimony that I submitted. Deaths precipitously dropped per capita, per miles traveled, and in absolute terms. Without curtailing anyone's vehicular rights, there were 36% fewer traffic deaths in 2014 than in the high watermark 35 years earlier. 36% fewer deaths. As awful as any motor vehicle death is, this decrease represented an incredible public health success. Which of us, our loved ones, our constituents, or other Mainers would not be here today if this public health effort were not mounted? I'm sure glad we saw past any concerns about the technical feasibility of collecting such data about motor vehicle accidents back then. So here we are in 2021. As I'm wrapping up, I point out that with firearm fatality rates in Maine over 3 times what they are in Massachusetts, I believe we can do something while preserving people's rights. We can apply a public health lens and pass LD 1392. I thank the committee for this consideration and be happy to take any questions.
Are there any questions for Representative Zager? The only question I have is about that last statistic, about 3 times the Massachusetts. Is that rate per 100,000 or per population? Or
it is, yes, it's a fatality rate, not an absolute number. We have, and I got that from the US CDC references. It's footnote number 3. It's actually more than 3 times as high. So in other words, if we could simply do what our peer state did, we would save 100 Mainers' lives a year.
Okay, thank you. All right, thank you for that testimony. And now we can hear from Barbara Arsenault. Welcome.
Thank you very much. Thank you for the opportunity to testify for LD 1392. My name is Barbara Arsenault, and I'm a resident of Rumford. I'm a retired high school guidance counselor and volunteer advocating for veterans through my membership through American Legion Auxiliary. I'm the rural engagement lead for Moms Demand Action for Gun Sense and live in a gun-owning home. I support the Second Amendment. With this background, I am testifying for LD 1392. For a healthier Maine, we need to have timely and accurate data on the current status of our citizens. This includes gun violence and how it affects our state. When we have up-to-date resources, we can move forward with effective prevention measures. Monitoring and evaluation are necessary components of the public health approach to prevention. It is important to have timely and reliable data to monitor the extent of the problem and to evaluate the impact of prevention efforts. In regards to homicides, I have turned to the private sector for timely information. Each January, Bangor Daily News has an article of the homicides in Maine, which occurred the previous year. Each tragedy is written with details of the place and weapon use. Last year, all 8 firearm-related homicides took place in the 2nd Congressional District. In 2019, 11 out of 14 firearm homicides were in my district. And in 2018, 6 out of the 9. An example of delayed information comes from the Veterans Administration, where information on state-by-state statistics are available with a 2-year delay. The 2018 statistics were on their website not until November of 2020. This is especially challenging if you're looking at a 3-year pattern, as 2015 is 6 years ago. Sadly, there were 47 veteran suicides in Maine in 2018, and 75% were by gunfire. 34 out of the 47 veterans were over the age of 55. I support LD 1392 so we can have an accurate look at our state and have healthy programs for our future. Thank you very much.
Thank you for that testimony. Is there any question? Are there any questions from Ms. Arsenault? I don't see any, so we can go to Camilla Shannon after you unmute. Thank you.
Good morning, Senator Claxton, Representative Meyer, and distinguished members of the Health and Human Services Committee. My name is Cam Shannon. I live in Yarmouth. I'm here today in support of LD 1392, an act directing the Maine Center for Disease Control and Prevention to release annually public health data regarding certain fatalities and hospitalizations. Every year, approximately 150 Mainers die from firearms. Countless others are injured. If made law, this bill would direct the Maine CDC to report data about these deaths and injuries to the Maine legislature. There are many reasons to support this law, but let me start with a basic one. More information is better. More data is better. It grounds the conversation in facts. Giving you an annual report and data does not compel action, does not take away your authority, does not determine policy, but it helps you shape it. You make your decisions based on facts, data, evidence. This report will help. Second, we know this kind of data in particular will help you address this particular problem. An annual report would help you as lawmakers understand the scope of gun violence in Maine and create policy that effectively responds to the problem. According to the American Public Health Association, APHA, gun violence is a public health crisis that requires a public health approach, including data collection and surveillance, research to understand which policies and programs are effective in decreasing gun violence, initiatives to initiatives to implement those measures that are shown to work, and continued surveillance and evaluation. In other words, the APHA would recommend a report just like the one outlined in 1392 to help reduce firearm deaths in Maine. If you need any more reason to support this bill, consider the following. The number of US motor vehicle deaths peaked in 1969 at a staggering 55,043 people. Scientists gathered data about when, how, and why these fatalities occurred and shared the data. Everyone came to better understand the problem. Driving under the influence was costing lives. Lawmakers raised the drinking age from 18 to 21, and public health professionals created campaigns to raise awareness about the dangers of drunk driving.
30 seconds, Kim.
Thank you. Engineers improved car design, adding anti-lock brakes, airbags, and seatbelts. Pediatricians convinced parents of the importance of always buckling. Now, far fewer Americans die in car accidents, only 11 deaths per every 100,000 Americans as compared to 30 back in 1969. This is a huge public health win, and it all started with data collection and dissemination. Please, let's do the same here. Please vote ought to pass.
Thank you for your testimony. Are there any questions for this witness?
Mr. Chair?
Yes.
Representative Craven had her hand up previously, and I wonder if she had a question.
Okay. Thank you.
I just wanted to know from Barbara Arsenault if she would send her testimony, and she was our last.
Hopefully Ms. Arsenault heard that request, and so we can have it available for you prior to our work session.
Thank you.
Representative Stover?
Yes, I had a question, maybe not for this, it may have to be for the work session, but historically, there was a report published annually on injury and violence. I think it was called the Maine Injury Prevention Program through the Maine CDC. I don't know whether or not that section got eliminated or whoever would have been responsible for the report, but some of this data was captured previously. I'm going to guess that that got cut, as many things did, but I just wanted to see if that actually still exists within the CDC and if they're capturing any of this data, or did it get canned and we're starting from fresh again?
Sounds like a question for Kristen Braun and the work session. Thank you. Any other comments or questions? Not seeing anybody. I'll remind everybody that we're hearing from folks in support of the bill right now. And it works out that it's alphabetical by first name, so we will be getting to you. Next, we'll go to Chris Campbell. Welcome.
Thank you. Senator Claxton, Representative Meyer, and distinguished members of the Health and Human Services Committee. Thank you for your work on behalf of the health of Maine citizens. I am Chris Campbell. I live in Belfast. I'm testifying because I am a grandfather of 3 children who live in Maine. They are vulnerable to firearm mortality, and LD 1392 would help reduce it in our state. Part of the need for this important bill is that some people think Maine's firearm mortality is not a problem. The data say otherwise. As mentioned earlier, the National CDC annually reports firearm mortality, and the rate in Maine in 2019, the last reporting year, was 11.5 firearm deaths per 100,000. This number is higher than that of Massachusetts, as well as every other New England state, plus New York, plus New Jersey. An important responsibility of the Maine government is health of its citizens. The Maine CDC plays a leading role in public health, and it is slated by LD 1392 to play a leading role in data collection about firearm mortality. When dealing with complex problems like firearm mortality, it is essential to collect data that will lead to good decisions. As we all know, the Maine CDC has been collecting data about COVID-19 to address questions like, where is it surging? What is it? Who is most vulnerable to it? And how do we limit its damage? COVID took a terrible toll on Maine with 777 deaths in 2020. The US CDC reported 163 firearm deaths in Maine in 2019. That's the latest data available from the CDC. This is about a fifth of the 2020 COVID death rate, but COVID will likely be controlled. The death rate of the opioid epidemic lies between the firearm and the 2020 COVID rates, but we can hope that that will taper. Gun deaths, however, may go up because of a large recent increase in gun purchases in Maine. Very sadly, 88% of the 163 gun deaths in 2019 were suicides, mostly by young people. The possibility of a school shooting exacts a toll of anxiety on children and parents. LD 1392 directs the Maine CDC to collect data about Maine firearm mortality that will help reduce its tragic impact on our state. I urge you to vote for this bill. Thank you.
And thank you, sir. I see we've been joined by Representative Griffin. Would you care to introduce yourself?
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levan, and Kenduskeag.
Thank you. And Senator Moore, welcome.
Good morning. I apologize for being late. I was presenting a bill in ACF, so trying to be in 2 places at one time is a little hard. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Thank you. So we'll proceed. Now we can hear from David Wenberg. Welcome, Doctor.
Good morning, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is David Wemberg, and I reside in Cape Elizabeth, Maine. I'm a physician and moved to Maine in 1987 with my wife, Senator Ann Carney, to do my residency at Maine Medical Center. Afterwards, I went to the Harvard School of Public Health and then returned to Maine to do clinical work, teaching, and public health research at Maine Medical Center and the Maine Medical Assessment Foundation. For the last 20 years, I have been on the healthcare business side, most recently as the CEO of Quartet Health, a company whose mission is to improve the lives of people with mental health conditions. I recently stepped down from the CEO position, but remain on the board. I am also an avid outdoorsman. I love to fish the waters of Maine, and while I'm not a hunter, I have deep respect for those who hunt for food and sport. As a recent CEO of a healthcare company, I could speak to the data that find that firearms are used in over half of all deaths by suicide. However, instead, I speak to a study published in the New England Journal of Medicine in 2018 by Dr. Rebecca Cunningham and colleagues from the University of Michigan, identifying the leading causes of death in children and adolescents. They found that firearms were the second most common cause of death for those between the ages of 1 and 19, exceeded only by the deaths of motor vehicle crashes. More interesting were the changes in mortality rates from motor vehicles between 1999 and 2016. As others have noted today, they found that deaths by motor vehicle crashes decreased by nearly 50%. Why did this happen? Significant funding for research at the state and federal level identified the proximate causes of automobile injuries. This research resulted in important changes in policy that led to airbags and the routine use of seatbelts and child seats for children and adolescents. Deaths by firearms over those same 18 years were unchanged. How did the researchers know the cause of death when the Dickey Amendment has prohibited funding for firearms research for over 20 years? It's because death certificates are routinely collected and they have the cause of death. Yet, as we know from COVID-19 pandemic, death is but a lagging indicator and the tip of the iceberg. There are many more injuries and disabilities than there are deaths. Dr. Cunningham could not say how these injuries might have been avoided. If we had treated gun research in the same way we have treated motor vehicle research, we would be able to answer the questions such as what's the impact of trigger locks, gun safes, or safety training on the injury and death rates related to firearms. Unfortunately, without the routine collection of data, these questions are unanswerable. As both a public health researcher and as a businessman, I know from experience that data and information are critical to good decision-making. For the esteemed members of the Maine legislature, collecting and analyzing data is key to sound policy. I urge you to vote ought to pass on LD 1392. Thank you.
Thank you for that testimony. Are there any questions for Dr. Wenberg? Nice to see you for the first time in a number of years.
Same, Ned. Thank you very much. Appreciate it.
Take care. We're also joined by Dr. David Fitz. Welcome, sir. As soon as you're unmuted, we'll hear your testimony. There we go.
Am I unmuted?
You are.
Thank you. Thank you. Senator Claxton and other representatives and senators of the committee, thank you for allowing me to testify. I'm a little bit disorganized. I'm working in the Scarborough Downs vaccination clinic right now, and I jumped off to take a break. I came to Maine as a general surgery resident in 1980 and have been here ever since. I'm a retired surgeon. I was a plastic surgeon and hand surgeon. I'm also a gun owner and hunter. And when I'm not hunting or sighting in my firearms, my guns are locked up in a safe and the ammunition is in a separate place. I'm here to testify very much in favor of this bill because it's a no-brainer. Data is everything. Anecdotes are important. Anecdotal reports that we see in the news are important, but they don't add up to much until you get the data. A simple thing that happened in Maine about 25 years ago, our data collection that had just started showed that there was an inordinately high number of C-sections being done in southern Maine. The data was examined carefully, and it was found that there was one hospital where there were 2 obstetricians whose indications were a little bit off. With that data and talking to them, they were able to turn things around and get Maine and get this get C-sections back where they should be with the rest of the country. In surgery and in all medicine, there is a whole very simple coding system. Any encounter, anybody comes into an emergency room or an office, a code is applied to them as to what the problem is. And in gunshot wounds, they are broken down as to whether they're intentional, whether they're accidental, where they are, and the data is there. The hospital's all collected. It's there. And it's important that we have an easy access to this in order to take care of this problem. It's an epidemic. Right now, we are solving a pandemic with simple cooperation of scientists sharing data. That's how we were able to get the testing ramped up, was by these people who figured out DNA and RNA sharing data with each other, and they decided to just do it. Sharing and obtaining data on gun-related injuries, gun-related deaths is everything. And I might add
30
that—
seconds, please, Dr. Fitz.
I'll finish with, when these bills, similar bills have come up in the past, opposition has claimed that where's the data? You can't have it both ways. If you don't have data, you don't have data. This data will be everything. And thank you very much. I hope this bill should pass. Thank you.
Thank you, Dr. Fitz, and for your current work at the Scarborough Downs. Are there any questions of the doctor? I don't see any, so you can get back to work. Thanks for being here. And next we'll go to Dr. Walworth. Welcome, East. When you unmute.
There we go. Hello, Ned, old friend and colleague. Senator Claxton, Representative Meyer. I'm Edward Walworth, and members of the committee. I'm Edward Walworth, a retired general surgeon in Lewiston. I worked for 33 years at both St. Mary's and CMMC, and would see the occasional gunshot wound. Did some work in Africa with Doctors Without Borders and saw plenty of gunshot wounds. So although I never did war surgery, I'm familiar with this, and it was never much fun. I'm not going to reiterate the statistics that you've heard, but I will say that I'm a member of the Public Health Committee, the co-chair of the Public Health Committee of the Maine Medical Association. And obviously, we look at public health once a month, all sorts of issues. This data would serve our purposes very well. It goes without saying. We're getting used to data every day. Here's the Lewiston paper this morning, and on the bottom, there's the box score of the CDC, the daily statistics of hospitalizations, deaths, you name it. Now, obviously, this bill would not publish such a thing every day, but in this instance, the public is looking at what is happening in the pandemic. And if only once a year we can see the gun injury and fatality statistics, that would be very useful. It's sort of like a box score that we all grew up with looking at the baseball results. As Dr. Fitz said, data is data, and you can't have it both ways. Maine is not a completely safe state in that regard, as the gun lobby would have us believe. And it goes without, you will recall that there was a federal law passed a while ago, 20 years ago, forbidding or preventing the national CDD from collecting gun data. What were they afraid of? That has been partly rescinded by under President Obama, I believe, although I think that law is still on the books. It may not be observed now, but data is scary to the gun lobby. So let's let's even the score here. I would just add one more thing to this bill, if possible. Here's the bill, the paragraphs A, B, C, and D, C being about fatalities and D being hospitalizations. Perhaps paragraph E could be added to talk about near misses. In other words, patients come to the emergency room with a grazed or a grazed wound or not requiring hospitalization, but those, a lot of bullets are fired. Not all
please, Dr. Walworth.
But I'm just saying that if this would be additional useful information. Anyway, please pass this bill. Thank you very much.
Thank you for testimony. There's a question from Representative Graven or a comment.
Thank you. Well, Dr. Walworth is my constituent, and I would like to thank him publicly for all the work that he's done over the years to reduce gun violence in Maine. So thank you, Dr. Walworth.
And I don't see any other questions. So again, thank you for being here. Good to see you again. So I'm going to turn the chair over to Representative Meyer while I step away and do some testimony in yet another committee. And I think that Judith Feinstein is up next. Thank you.
Thank you. Welcome, Ms. Feinstein. You've got very poor audio. We're not able to hear you, Judith. Do you want to lower your video, close your video, and try your audio again? No, we're not hearing you. I'm sorry. Why don't you try and remedy that, and we'll come back to you. Okay. With that, Lanny Graham, welcome.
Good morning, Representative Meyer, members of the committee. My name is Lonnie Graham. I'm a retired family practice physician and former chief public health officer for Maine. Currently, I serve on the Public Health Committee with Dr. Walworth, and I'm pleased to be here to support this important bill. Gun violence is a significant cause of premature death in the United States. You've heard some terrific testimony about this data in the United States and elsewhere. And while Maine does not have the homicide rate of some states, we do have a higher suicide rate than most other states, driven in part by impulse use of guns. But in Maine, as across the nation, firearms data has not gotten anywhere near the attention it deserves. And as was mentioned by another witness, since 1997, the Centers for Disease Control at the national level was actively discouraged from firearms data collection or research into the firearms issue. This curious legislative approach, fortunately the exact opposite of what we see in LD 1392, was an amendment known as the Dickey Amendment, and was followed up with a similar amendment in 2012. It seemed that the theory was that what you didn't know couldn't hurt you, or alternatively, if American people knew the health impacts of firearms, something might actually get done to address this public health crisis. The Maine legislature is now moving to show that Maine is not afraid of the truth, whatever it might be. It is interesting to think that the most recently required report to the legislature is about another public health problem that was also denied, the opioid epidemic. What we don't know or refuse to admit does hurt us, and good data collection is both a vital preventive tool and the very essence of public health. This is how effective public policy is developed. Data collection is the North Star of public health. While LD 1392 provides an excellent outline of good firearms data collection, there is more to consider relating to issues of concern, such as race, shootings by police, and the origins of firearms hospitalizations. At this stage, I don't feel sufficiently qualified to offer recommendations about the exact nature of the data needed and the best ways to collect it. But as someone who has served Maine people inside state government, I always appreciated being included in the legislative deliberations. I hope that for his representatives might be able to participate in a work session to make this bill a model for excellent and cost-effective firearms data collection. Thank you for your attention, and I hope you will be able to pass this bill unanimously.
Thank you, Dr. Graham. Questions from the committee? Seeing none, we appreciate your testimony today. Next, we'll try Judith Feinstein again and see if you've got your audio.
Okay, is this better?
That's perfect. Go right ahead.
I have two microphone settings, and on the other one, I sound like a chipmunk. So, and I never know what's going to happen. Anyway.
We prefer this version of you.
So do I. Good morning, and I know this is not a dental bill, and this is where you're used to seeing me. But Representative Meyer, Senator Claxton in absentia, and the members of the committee. My name is Judy Feinstein. I live in Hollowell. I'm a semi-retired public health professional and a former state employee, and I'm actually delighted to follow Dr. Graham, who I used to work closely with. I'm not going to reiterate a lot of the things you heard about the content of the bill or the data. I just would echo all of it. But I will say that in public health, we do rely on evidence and data to guide our work. I really want to reiterate that. For the Maine CDC to be able to accurately report on this public health problem, they need data. Many years ago, working with the Federal Public Health Service officer on one of the first grants that I administered in state government, that individual asked us about our plans for data collection. And there must have been a look on my face. And she said, almost casually, you realize without data, you are just an opinion. And her words have never left my mind. A cornerstone in public health work is the concept of prevention. Almost by definition, this involves monitoring the extent and impact of the problem being addressed. You heard a lot about that on Monday with the dental bills. We do this by collecting data. We need timely, consistent, and reliable data so that we can evaluate the extent of the problem and then monitor and measure the impact of our activities. We do this with all the other health issues that you've already heard about this morning. We're doing it with COVID-19. Gun violence has been termed a public health crisis and epidemic in this country. Having access to data about firearm fatalities and including it in public reports are functions that do belong in the Maine CDC so that sensible policies and programs can be developed and implemented. To me, this is common sense and also a matter of accountability. Gun violence is a serious public health issue in Maine. It's a heartbreaking public health issue in Maine, and it's one that we can and must address, and with our best resources. We really can't afford not to. I hope you will vote to support LD 1392 and any needs that DHHS and the Maine CDC would have in order to implement it. Thank you very much for hearing this bill.
Thank you. Seeing no hands up for questions, we will hear next from Lynn Ellis. Welcome, Lynn.
Yes, good morning. Senator Claxton, Representative Meyer, and other members of this committee. I speak to you today as a volunteer with Moms Demand Action for Maine. And part of my testimony was written by Janice Vance, who was not able to be here today. But I'll start with my comments. I'm from Brunswick, Maine, and I wanted to hold up Representative Bramlage, Representative Dudera, Representative Zager, and the other members, as co-sponsors of this bill, for recognizing what we work for every single day in this country as Moms Demand Action for common sense gun legislation with the goal to save lives. I'm not going to be heavy on data in this testimony, but on the awareness of gun violence in Maine and in the country. So here is where I'll begin with Janice Vance's testimony. Janice is from Kennebunk. Gun violence is a public health crisis across the country. Like the opioid crisis, it's a symptom of deeper societal problems. But without research and data to tell us how bad the problem is, we cannot create good policy to address it. And when we don't track and publicize the numbers of Mainers killed or injured each year, it's easy for some people to pretend we don't have a problem. We need data to understand how best to prevent suicide by gun, which we do know is higher in Maine than other states. We need to know how to proactively prevent domestic violence with firearms, deaths by firearm in domestic violence situations, keep children from accessing loaded weapons. Police departments need to track officers' firearms use and access their fitness for duty. We need to know the types of injuries being caused by firearms with recognition that some are designed simply to kill I'm talking about firearms, the highest number of people in the shortest amount of time. We all know how seriously visitors to Maine take the phrase, Maine, the way life should be. Let's ensure we put action behind those words by making our state as safe and healthy as possible. Please pass LD 1392, and thank you for your time.
Thank you for your testimony. Seeing no hands up for questions, we will hear next from Maura Pillsbury. Welcome, Maura.
Thank you, Representative Meyer, and good morning to the members of the Health and Human Services Committee. Thank you for the opportunity to speak with you this morning. My name is Maura Pillsbury. I'm a volunteer with the Maine chapter of Moms Demand Action for Gun Sense in America and a resident of Freeport. I'm testifying in support of LD 1392. As a former researcher for the Maine legislature, I understand the importance of making evidence-based decisions. This bill will help us do just that. As others have said so well already, consistent data allow public health agencies and other entities to better gauge the scope of a problem, identify high-risk groups, and monitor the effects of prevention programs and policies. It is important to have timely and reliable data to monitor the extent of the problem and evaluate the impact of prevention efforts. Data is also necessary for prevention planning and implementation. For far too long, the federal government failed to fund any research on preventing gun violence, and others have already mentioned that this was due to the Dickey Amendment. And I want to ask you to imagine if the automotive or pharmaceutical companies or industries had succeeded in doing this, because this bill was lobbied for by the NRA. Now, sadly, gun violence is a public health crisis in America. There is a demonstrated need for additional research to guide policymaking, and that includes data collection. LD 1392 will help ensure the state of Maine has clearly defined data collection procedures that are a crucial part of reducing gun violence in our state. As a mother of 2 young children and a local elected official, I have watched with growing concern as gun violence has escalated in Maine and around the country. In an average year, 249 people are shot and killed or wounded in Maine. That is about 5 people every week. The traumatic impact of these tragedies ripples across our small and close-knit communities. We must track information about these incidents of firearm death and injury to understand and address the problem we are dealing with. The information collected by this proposed law will further our understanding of gun violence and its impact in Maine and help us understand how we can prevent it. Research and data are integral to prevention, but without adequate resources, researchers like myself are prevented from thoroughly examining gun violence and gun policies, which is what you count on as legislators, the information from analysts like myself. You can help change this by supporting LD 1392. Thank you.
Thank you. Seeing no raised hands for questions, we will hear from Polly Frawley. Welcome.
Good morning. Hello. My name is Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Polly Haight Frawley. I live in Cumberland, and I am testifying in support of this LD. I was Chief of Operations for a behavioral health care provider for 14 years. Each year, we studied the annual report put out by Maine's Office of Behavioral Health, or its predecessor, it might have been under a different name, on drug use in Maine. My company was in the business of prevention and treatment, trying to save lives. That report was studied, discussed in-house, and analyzed at gatherings of providers. Changes were made in services provided to try to address the findings in the report, targeting the populations, ages, counties, and drugs identified in the report. If you look for data on injuries and deaths caused by guns in Maine, there is a lack of centralized database. For example, the Department of Public Service compiles extensive information on crimes in Maine, but does not address gun violence that is not defined as a crime. Similarly, the Domestic Abuse Homicide Review Panel issues a report that just came out yesterday that is limited to domestic violence. The Maine CDC addresses suicide by gun, but the data on its website dates from 2016 and 2017, some of it from 2010 and 2012. This is the most recent data on that site, in spite of the fact that the report provides horrifying data that suicide among Mainers aged 10 to 14 is the second most leading cause of death, and the use of firearms was the most frequent method. As we all know, mental health problems have only grown during the pandemic. And we also all know that the number of guns in Maine has grown as well, a 50% increase over the previous year. How can we address what is clearly a growing gun violence crisis in Maine unless Maine legislators, government officials, and citizens have complete up-to-date data and it can be found readily? This is not much to ask, considering the lethality of a gun. Thank you.
Thank you. Questions for Polly? Seeing none, we'll hear next from Nicole Palmer. Welcome, Nicole. You're on mute, Ms. Palmer.
Thank you. Sorry. Can you hear me now?
We can.
Thank you. Senator Claxton, Representative Meyer, and members of the Committee on Health and Human Services. My name is Nicole Palmer and I live in Bowdoin. I've been an educator for almost 20 years. I'm also a professional classical singer and I'm a new mom. I speak to you in favor of LD 1392. I used to think that gun violence was something terrible, but something that would never affect me personally. And then I happened to be living in Connecticut when the massacre at Sandy Hook Elementary happened. 3 of the children who were killed were 1 degree of separation away from me. And that's when I started to really pay attention and to think about how I can make a difference to prevent gun deaths. Since moving to Maine, I have met many people whose lives have been irrevocably harmed by gun violence. I'm thinking of Judy and Wayne Richardson, who lost their daughter Darianne after she was shot in a home invasion in Portland. I'm thinking of a friend who lost a brother who was a bystander in a shooting, and then her father who took his own life by gun. I'm thinking of the 2-year-old in Waterville who was shot in the head by his sibling in January. I'm thinking of a teenager who shot and killed herself in Western Maine in recent weeks. Tragedy upon tragedy. These are the real life consequences of our state's current laws. This bill is not partisan. It does not call for restriction on anyone's rights. It does not grant certain rights. This bill is, at its heart, a bill about truth. Either we as a state want to know the truth about gun deaths and injuries that happen, or we don't. Either you will vote in favor of learning the truth, or you won't. I would argue that knowing the truth is better than living in ignorance. It allows us to learn and do better. It allows us to identify and respond to changes in trends. It allows us to make decisions that are in the best interests of health and public safety. While the data that this bill purports wants to put together is currently available in certain places, it is available with great delay and is not all available in one place so that we can easily react to and understand the realities of what's going on here in Maine. There has been a movement in our country to reject science, to reject things that are objectively true, to create one's own reality. This thinking often results in tragic and unnecessary deaths. I'm thinking of the attack on the Capitol on January 6th, which was fueled by lies. I'm thinking of our nation's paltry and feeble response to COVID, which was based on lies about the virulence and dangers of the disease, and which resulted in hundreds of thousands of avoidable deaths. Maine has been a leader in fighting COVID because we have people like Dr. Shaw and Governor Mills who appreciate that data and science that science and the data it provides can help us make the best decisions. Let's make sure that we bring that same sensible approach, guided by learning the truth, to the issue of guns here in Maine. Please vote in support of LD 1392. Thank you very much.
Thank you for being here today. Seeing no hands up for questions, we will hear from Hillary Shendy. I hope I have your last name right.
Shende, yes, thank you. Senator Claxton in absentia, Representative Meyer, and members of the Health and Human Services Committee. My name is Hillary Shende, and I am from Brunswick. I'm here today in support of LD 1392 because information is vital to a functioning democracy. The more information we have, the better decisions we can make as a state and as a country. With less information or with scattered information, Legislators must become investigative journalists, hunting and pecking under various rocks in order to craft legislation to address the needs of our state. This bill would formalize and centralize the reporting of firearm deaths and hospitalizations. In the same way, we formalize and centralize the reporting of opioid statistics. This information will then allow us to craft fact-informed legislation to address the question of how to prevent those deaths and hospitalizations. As a member of the public, I represent the majority of Mainers when I say we want evidence-based policies. Thank you very much.
Thank you. Questions from the committee? Seeing none, thank you for being here today.
Thank you.
We will hear from Susan Kistenmacher. Welcome, Susan.
Hi, I'm Susan Kistenmacher. I live in Farmingdale, Maine. I'm a retired middle school teacher. When you go near the end, most of your testimony is already said, so I'll just quickly tell you, you've heard from a lot of people this morning about the importance of data collection to understand a problem and to construct meaningful legislation. And in this case, that would be legislation that would reduce gun deaths, yet still protect our Second Amendment rights. And we've all decided that gun violence is a public health crisis that we need to take a look at. Let's do it right. Let's collect and look at data. Please support 1392. Thank you.
Thank you. Questions for Ms. Kistenmacher? Seeing none, thanks for being here today. So that concludes testimony in support of the bill. There is no one in the queue supplying testimony in opposition. So we'll move to those providing testimony neither for nor against, but with additional information for the committee. And we'll hear first from Jeff Austin. Welcome, Jeff. Jeff Austin. We'll circle back to Jeff and hear from Jonathan Wilson.
Representative Meyer, Senator Claxton, distinguished members of the committee. My name is Jonathan Wilson. I'm a sergeant with the Maine State Police. I oversee the records management unit, which includes uniform data collection, uniform crime data collection at the Department of Public Safety. I present this testimony on behalf of the department, neither for nor against LD 1392. My purpose today is to present information relevant to the data that is currently collected by law enforcement agencies in Maine, as well as any logistical and technical hurdles this bill may present in terms of collection of the additional data. The bill proposes to collect the data on firearm-related fatalities sorted by victim age in those four specific categories of homicides, suicides, accidents, and hospitalizations that do not result in death. Also looks to collect information as to the type, make, and model of firearms that are involved in each of these incidents. As you may know, Maine State Police oversee the data submission of uniform crime reports, or UCR, for every municipal, county, and statewide law enforcement agency in the state. Those UCR data collection standards are set by the FBI, not at the state level. And of those four categories presented for data collection through 1392, currently only homicide data is collected in UCR. And that homicide data does not include specifics on firearm makes and models. The other three categories of suicides, accidents, and hospitalizations are not crimes in and of themselves. So therefore, they don't fall under that data collection that's established by the FBI. This means there's currently no centralized repository in DPS from law enforcement where that data on suicides, accidents, or hospitalizations can be compiled and provided to the CDC. As others have commented on, we need to collect the data in order to report on that data. And currently there's no statewide data collection standards in Maine for those types of reports. While it's extremely likely that an agency will collect that information on a firearm involved in a suicide or accident, that data is currently only housed at that individual agency. Per that agency's policies on reporting, it is not compiled or accessible in any centralized database within DPS. In addition, the last categorization of hospitalization may present some unique challenges. While hospitals are mandated reporters for gunshot victims that come to their facility, police reports often will not have any sort of standardized data regarding that hospitalized information on their law enforcement side of it, other than listing the hospital as the entity that called in that complaint. What this leads to is that in order for data collection from DPS to be successful, a centralized repository would need to be established where law enforcement could submit that relevant data in a standardized fashion.
30 seconds, please.
Such a repository would have to be constructed and maintained on an ongoing basis. This would allow for the collection of vetted information in that standardized fashion, and for such information then to be provided to the CDC. Research would have to be done as to costs to maintain and build that database, as it would undoubtedly require substantial costs. In conclusion, I ask you please weigh this information presented in this testimony. And on behalf of the Department of Public Safety and Maine State Police, I thank you for your time. If there are any questions, I'd do my best to provide more information on any future work session. Thank you.
Thank you. Representative Zager, question for Sergeant Wilson.
Thank you, Madam Chair. Sergeant Wilson, first of all, thank you so much for serving our state and the state police. I appreciate you providing the information. You referenced the standards the FBI has for data collection. Are those minimum or maximum standards? In other words, is there anything in those standards that would prohibit the state of Maine's law enforcement or health infrastructure from collecting the data in the bill?
No, there's no prohibitations other than the technical prohibitations. There's a minimum nationwide standard for IBR or UCR, depending on how it comes in. The only issue that comes up if you use that same platform is then every records management system used by all these police agencies throughout the state would have to pay the costs to adjust and update their system, which may be prohibitive if you try to go through that federal route as opposed to establishing a different central repository.
Thank you very much. Appreciate it.
Seeing no other questions, thank you, Sergeant, for being here today. We will go to Jeff Austin. Welcome, Jeff.
Representative Meyer, members of the committee, my name is Jeff Austin. I'm here on behalf of the Maine Hospital Association. My apologies, I decided to take a call when I probably shouldn't have, and please forgive me. I provided you written testimony, and I mentioned in my testimony that we would prefer that this data collection, if it be done via Maine Health Data Organization. MHDO is a central repository for claims data, and they would have what the hospitals have. So instead of surveying 33 emergency rooms, you could simply pull the data from MHDO. I did reach out to MHDO, and they did confirm that they had the data points that I outlined in my testimony, the 5 types of gunshot wounds: accidental, suicidal, homicidal, unknown, gunshot of unknown intent, and law enforcement. Neither the hospital nor MHDO has the second half of the data request, which is the type, make, and model of the weapon. I don't think that data is captured in any regular fashion. It may be known sometimes to the surgeons. The family may come in on a suicide and say, yes, they used my pistol, or yes, they used my shotgun, but I don't believe that data is captured, and MHDO does not have type, make, and model either. So we would suggest that be amended out of the bill, or at least in terms of collecting it from us or MHDO. So with that, I'd be happy to take any questions.
Thank you. Questions for Mr. Austin? Yes, Representative Craven.
Thank you, Madam Chair. Hi, Jeff. Do you have to report now to the CDC every time there's an incident in any of the hospitals?
I believe there is mandate. Yes, there are different mandatory reporting statutes, and I believe this is one, but I did not review it prior to testifying this morning. So I'm not sure what all data elements have to be included in that mandatory report.
Yeah, I just wonder why it would cost, it would be such a big effort for law enforcement to report what they already collect. And I know that it isn't you that I should be asking this of, but making the comparison that the healthcare community have to do the reporting, why would it cost law enforcement so much more to do that?
Well, obviously I don't represent law enforcement. I can't speak for them, but I think the idea is we have an MHDO. So the hospitals have this information individually, but then an MHDO also exists where the data is centralized. I believe the gentleman from public safety was saying just as the hospitals have information, each law enforcement agency has information. They don't have their version, I think this is what he was saying, of an MHDO where they're obligated to report that in. Why you couldn't say to each law enforcement agency, you shall take your mandated reporting information and send it to the CDC on an annual basis or a monthly basis, whatever you want to do. You got to make somebody your centralized data receiver. We have one in MHDO. You could make it the CDC that as well. But I don't know that statute well. I'd have to relook at it. My apologies.
Thank you.
Seeing no further questions and no further testimony
Thank you.
To be delivered, I would ask the committee if they've got requests for additional information for Kristen Braun. Oh, I see Ann Perry's got a question or request for information.
Request for information. I would actually like to hear from MHDO in terms of the data they collect and if that's actually able to be pulled on that, because I think it requires might require a certain type of diagnosis on that part, but I think that would be worth checking. And in terms of police departments do not get called in for suicides or do they? And do they get also called in for accidental shootings?
Thank you, Representative Perry. Any additional requests for information? Yes, Stover.
I had mentioned earlier that I was just curious if the main CDC is still collecting information or providing the report on injury and violence under the main injury prevention program. Thank you.
And I would like a bit more information on the Dickey Amendment.
Okay.
Seeing no other hands up, we would thank you, Representative Gramlich, for bringing this legislation before us today.
Thank you, Representative Meyer, and thank you, HHS. I know you guys have a full docket and really appreciate all the hard work you're putting in.
Thank you. So that concludes our scheduled work for the morning. We do have some work sessions in front of us this afternoon, beginning at 2 o'clock, I believe. Unless there's any other work that Kristen wants to bring to our attention?
No, I don't have anything else.
Thank you. Thank you. So the committee Democrats will caucus again at 12:45. And we will see everyone back here at 2 o'clock this afternoon. I would entertain a motion to adjourn.
So moved.
Second.
See you at 2. While we're waiting, I'm just going to duck away for 2 minutes.
Okay, we won't start without you.
Oh, you can't.
So Senator Moore and Representative Griffin, how's your caucus energy level for a long afternoon?
We're good. We whipped right through it.
I was thinking that depending on how it goes, we might be looking to quit 3:30 or 4 o'clock and pick up where we've quit, wherever that is.
I'd rather, well, I want to go home tomorrow at a reasonable hour. Let's put it that way. Rather than making tomorrow a long day, today would be
You're in the
better.
wrong business. You're in the wrong business.
I know. Well, rather than making today a short day, I would rather we made it longer today. That would be
All
my
right.
preference. That would be
All
my
right.
preference.
What about you, Representative Griffin?
I'm fine either way. I'm already.
Okay.
So.
Okay. Well, I think we could probably, Erin is having to move her base of operations closer to her wireless router because her audio was tanking when she had her video on. So she's in the process of moving. I see Carrie's here. Hello, Representative Javner. All right, so we'll go ahead and get started with introductions and add people back in as we need to. Welcome to this afternoon's hearing. I think we will introduce ourselves since it's been a while since we've been here. We have a number of bills to work this afternoon, somewhere between 9 and however many we want to go. We'll take them in the printed order, Carrie, that they're already on the calendar. And so this is work session. We have people who will be joining us who may have something to contribute. If you're one of those folks and feel like you have something that we need to hear, please put your hand up and we'll try and recognize you. It's harder in the electronic world than it would have been in the committee room where you could have waved your hand and gotten our attention. So let's go around the horseshoe and start with Representative Zager.
Good afternoon, Sam Zager, District 41, Portland. Nice to see everyone.
Representative Lemelin, there you are.
Good afternoon, everyone. I'm Michael Lemlin. I represent District 88, Chelsea, Jefferson, Whitefield, and part of Nobleboro.
Representative Stover.
Good afternoon. My name is Holly Stover. I represent House District 89, including Boothbay, Boothbay Harbor, Southport, Edgecombe, Westport Island, and part of South Bristol.
Representative Perry.
Oops, good afternoon. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Barron, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Representative Javner.
Good afternoon. I'm Representative Kathy Javner. I represent House District 141, which is located in Penobscot and Washington County.
Representative Craven.
Thank you, Mr. Chair. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Griffin.
Good afternoon. My name is Abigail Griffin, and I represent House District 102, which is Glenburn, Levant, and Caduscade.
Senator Moore.
Good afternoon. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative Meyer.
Thank you, Mr. Chair. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is Elliott, where I live, and parts of Kittery and South Berwick.
And I'm Ned Claxton. I represent Senate District 20, which includes Auburn, where I live, Minot, Mechanic Falls, Poland, and New Gloucester. We are ably assisted by our staff today, starting with Ms. Dooling.
Good morning. My name is Erin Dooling. I'm one of the legislative analysts with the Health and Human Services Committee.
And Ms. Withy.
Good afternoon. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
So I have to say it was nice to see all of you or most of you in the flesh yesterday. That was a nice change. Hopefully there's more of that in our future. So if there's no other business to attend to before, we can start with consideration of LD 497. It's currently on the table, so we would need a motion to take it off the table.
So moved.
Is there a second to the
Second.
untabling motion?
Second
Okay.
it.
I think we can do this with a show of hands. Is everybody comfortable with taking it off the table for consideration? Please so indicate. There we go. Unanimous of those present. Thank you. So we'll start with the analysis from Erin.
I already presented my
Oh, that's right.
analysis
That's
on this
right.
bill. The sponsor had authorized me to share with you her proposed amendment, but I typically don't offer.
That's right.
Can't
No, no.
offer amendments.
Does somebody else want to speak to Representative Madigan's amendment? I think, right. Yeah, it was Senator Madigan, Representative Madigan. Yeah, Senator Moore.
Yes, I was just wondering if Dr. Landry is in the attendee office or the attendee portion. I would like to hear his opinion if he's had a chance to take a look at the committee amendment and see what his thoughts are about it.
Okay, we will be moving Molly Bogart in.
Okay.
Good afternoon. I'm Molly Bogart, Director of Government Relations for DHHS. Dr. Landry is logging in shortly. I was to let him know when we started, and he's still on his way.
Okay, so who wants to speak to the amendment that's been proposed? Don't all jump at once.
I can do that.
Good.
I mean, I can certainly read to the committee what the amendment does, what it is.
You want me to share my screen, Representative?
That would be helpful. So, not having been a part of the development of this amendment, I really can't speak to it. It's here before us.
It changes the bill entirely to
it
a
does.
request for a report on Family First and how that's impacting abuse prevention efforts. So it's pretty much as it's stated there, and it requires a report by next January. And we've talked about the possibility of some interim reports along the way about how things were coming, because there's grant money involved in October or before that. There's other monies. So this was just a way to at least have by January 15th, some follow-up from the department about how things were going in the arena of child abuse prevention efforts as related to Family First. The concern that had been raised before was that there was not enough prevention work in place in the new Family First. It was really directed more towards evidence-based offerings as a treatment, but not necessarily as evidence-based offerings for prevention. But so it's a report back as of January 15th on how things are progressing. So Molly, is that a fair summary of what you understand the amendment to be?
Yes, yeah.
Okay. And I see we've been joined by Dr. Landry. Welcome.
Thank you. Happy to be with you.
Any response to the proposed amendment, which is a report back by mid-January on how things are progressing?
No, we were happy to work with the sponsor, and my thanks for the opportunity to do so. I think this does provide us an opportunity to be able to report back to the committee on the efforts that are being done. Family First and the Family First Act make it really clear that their focus really is on what we would call tertiary prevention of the prevention of immediate removal of a child into care. However, we've gone beyond that in our plan to indicate that we certainly want to make sure that we are paying attention, particularly to secondary prevention efforts and those primary ones as well. And so there are some pieces that we have in place that we've discussed with the committee, such as the work that Christine Theriot is doing around building a more collective group at the state level around prevention efforts. Again, I do believe, I want to be clear, I think you'll see more focus around the tertiary pieces, because that's what we have to do federally and can only use the federal money for, but we're not leaving out the secondary and primary pieces. So I think this does give an opportunity for us to do that and report back to the committee and answer questions then that you may have about that progress. January, I think, is a good time period in general, because as many of you know, we intend, assuming federal approval, we intend to be able to implement Family First on October 1, with some components of our implementation kicking in January 1. But I do think it'll give us a good opportunity for us to provide you with an update. And this is certainly something that we're comfortable moving forward with.
Thank you for that. Does that answer your question, Senator Moore?
It certainly does. I just wanted to make sure that Dr. Landry was okay with this. It's great. Thank you.
Thank you for the question. Is there any other comments or questions, concerns related to LD 497 and its redrafted format? Yes, Representative Meyer. Representative Meyer, you're still muted. Did you have your hand up?
Sorry about that, sir. No questions or discussion. I'd like to make a motion.
Please.
I would move that LD 497 ought to pass as amended.
And I second that.
And there's a second. So the motion on the floor is ought to pass as amended. The amendment is the one that's been offered to us by Representative Madigan after working with the department. Any discussion about that? So we'll turn to Ms. Withey and start around the horseshoe.
Representative Zager.
Yes.
Representative Zager. Yes. Representative Lemlin.
Yes.
Representative Lemlin. Yes. Representative Stover.
Yes.
Representative Stover. Yes. Senator Baldacci.
Yes.
Senator Baldacci. Yes. Representative Perry.
Yes.
Representative Perry. Yes. Representative Griffin.
Yes.
Representative Griffin. Yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven. Yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
Yes.
Representative Javner. Yes. Senator Moore.
Yes.
Senator Moore. Yes. Representative Meyer.
Yes.
Representative Meyer. Yes. Senator Claxton.
Yes.
Senator Claxton. Yes. That's 11 yes, 2 absent.
Thank you very much. So now we can move to consideration of LD 1301. And I see that Representative Collins is in our waiting room, so I'll move him in, except that I'm not as fast as Carrie Withey. So we'll welcome Representative Collins when he makes the transition. And then he can hear the analysis. Welcome, Representative Collins.
Good afternoon.
We're just about ready to hear from Erin about her legal analysis report.
Okay, great.
Can you see that okay?
We can.
Okay. LD 1301 is an act to support transitional housing for persons experiencing abuse, dangerous living conditions, economic insecurity due to divorce or separation, chronic homelessness, substance use disorder, or mental disorders. And it directs the department to coordinate and arrange for transitional housing and services, including job training and healthcare services for persons in all of the situations that are identified in the title of the bill, including post-traumatic stress disorder. In every county of the state or by region, if all counties are provided for. It also provides an ongoing appropriation to support transitional housing in the amount of $8 million beginning in the next fiscal year. The department raised in its testimony that it provides these services through other programs, including TANF, Aspire, Food Supplement Employment and Training, the HOPE program in GA. In terms of drafting, I just was looking for a little clarification on the Blippi or the initiative language. It says that the funding is to support transitional housing, and I was wondering if that was intended to include just the housing piece or also the services such as job training and healthcare that are identified to direct the department to provide. And then there was some additional information requested by the committee in regards to which office within DHHS would administer the proposed program. And we heard back from Molly that she assumes that it would be OFI, but if the legislature wanted to direct a different office, I suppose that they could do that if it so chose. And the fiscal impact hasn't been determined yet.
Hey, does that raise any questions for committee members before we go to the sponsor? I'm not seeing any questions or comments. Anything you'd like to add to that, Representative Collins?
Thank you, Senator Claxton, Representative Meyer, members of the committee. I just wanted to follow up on the one point of the analysis is that I did intend that was the main component really in my mind was the facilitation by the department. So all those services and programs and needs, I would hope that the state could help with that. And I wish I could have had Senator Libby from Lewiston in this work session with me because after the public hearing, he went into detail in a conversation with myself and other legislators on work he did in the greater Lewiston area on housing the homeless population. And what he did with many other partners is exactly what the heart of this legislation is about. And it was astounding. I was so amazed at how successfully that work went as far as the percentage of people they found housing for, the services they helped them get. And as you recall in the public hearing, that was the original inspiration was the years ago when Salt Lake City did a housing model for homeless based on what this bill gets at. Senator Libby's work in the Lewiston area, Androscoggin County, did exactly that. And unfortunately, I couldn't get him here with me, but the results are amazing. So it does work. It worked in Salt Lake City. It worked to the extent we did it in Portland. And I believe that at the least the state should look at how this could be implemented or at least study or give some feedback on how something like what happened in Lewiston could be done throughout the state. So
Okay.
that's my only comments I wanted to add to what the analyst said. So thank you.
Okay. Anybody want to share any other comments related to this bill? Yes, Representative Perry.
Yeah, I had a question because there were a number of things I think that we passed out of committee around homelessness and stuff. And one of the things I was wondering about is the FUSE program that I think that we passed and how that would fit something like that, like what's going on, because that is looking at that as a statewide program, right?
I can answer that if you want, Representative or
Please.
Chair. Yeah. So the FUSE program, I think it's LD 475 would convene a group of stakeholders statewide to work on housing. I think they're the people who are homeless, who are long-term homeless, experiencing long-term homelessness. And they estimate that's about 200 people. And I don't believe that there was an appropriation attached to that bill. It was about convening the group around the table to help set plans for people who might be the hardest to house and use the most expensive services.
Any other comments or questions? Did I see your hand up, Representative Zager? No.
Thank you, Mr. Chair. I was just going to offer similar comments.
Okay. Okay. And in conversations, I was attracted to the transition for a portion of the bill, this transition for housing from incarceration. That sounds like a really key piece of this puzzle. Is that addressed anywhere that you know of, Representative Collins, in other homeless pieces of other legislation related to homelessness in this session?
Thank you for the question, Senator Claxton. I am not certain on the answer. I'm not sure if it is, because some advocates, after I submitted this bill, told me I should have mentioned that, which I didn't focus on, but I thought was a valid point. And I believe that is a really big factor. And after I was educated on it after the public hearing, I agree that just with all the other categories that would lead someone to be in the situation, I think that's an overlooked issue. And so I'm guessing that there isn't really much out there to address that based on the feedback I had and why people said it should be included in this proposal or in some other vehicle that could get you all there. So
okay. We also the issue around youth homelessness was raised, but we've already heard 4 bills related to that in this session. Representative Javner.
Thank you, Senator Claxton. I have a question concerning the fiscal note. I mean, in the summary of the bill itself, it says it's asking for $8 million starting in 2022 to 2023. Can someone address that, please?
Sure, Representative Collins.
Good afternoon, Representative Javner. Yes, that was a conversation starter for the committee. That's not a true analyzed fiscal note. That was just based with the context. If we did it by it could be done by other regions that some other organizations or governmental entities organize around. But for the sake of just moving this forward, I thought, as in with many ways we organize in the state, it's by the county level. So I said 16 counties times $500,000. I just came up with that as I thought would be a reasonable amount. I would say that if you move forward to any extent that there would, the real ballpark figure more accurately would come about. And then you could, maybe I'm right, maybe I'm completely wrong, but I just thought that might be reasonable to facilitate on a countywide level all these program and services in an efficient and meaningful way.
Okay, great. Thank you. I appreciate that. So it's a pretty arbitrary number.
Yes, ma'am.
Very good. I see we've been joined by Representative Connor. Would you care to introduce yourself, sir? Welcome.
Thank you, Mr. Chair. Good afternoon, everyone. My name is John Connor. I represent House District 58, which is part of Lewiston.
Senator Moore.
Thank you, Senator Claxton. I really don't have a question. I just have a comment. In looking through everything and reading the department's testimony, I'm really concerned about us duplicating something that the department is already doing, that it's already being done very, very well. And maybe it hasn't tapped into some of the folks that Representative Collins is talking about, but I really would, I just can't see us duplicating it. So I'm going to make the motion of ought not to pass on LD 1301.
There's been a motion made.
I would second that.
and a second. And I saw Representative Zager, your hand was up.
Thank you, Mr. Chair. I was perhaps Ms. Bogart could offer comments on efforts that the department is ongoing in this regard that might be complementary or in line with this, or not. Interested in the department's input.
Ms. Bogart.
Thank you. I mean, I think I'll mostly let our letter speak for itself, but I do know that there's additional work coming from, rent relief and other housing funds coming through the American Rescue Plan. And so I'd be more than happy to get you some additional information about what housing work is forthcoming that would be above and beyond what we're currently doing.
Representative Stover had a question, comment? When you're unmuted,
Sorry
There you
about
go.
that. I had a brilliant thought and you missed it. I was just going to add to what was previously said. I think that the intent of this bill, very well intended, and it didn't have really the time to put together something different, but I think that the intent remains to help the shelter people. And I live in a district in a county where we don't have a shelter, and we also don't have a domestic violence shelter. So we're in a hardship. So something like this would have helped, but I think there will be additional opportunities. I really hope so.
Representative Craven.
Thank you, Mr. Chair. I wanted to thank Representative Collins for bringing this forward. And we've had a lot of bills that were tidy and that we have voted out of our committee. And I just feel the bill is a bit cumbersome, and would love to, we have, I don't know if you know Heidi Brooks' bill that she's been working on to have a halfway house for adolescents coming out of incarceration. That I think would be great, although there's no funding mechanism for it yet. And so there's a lot of pieces in the bill that I really, really like, but
We're not hearing you again. Representative Craven, we didn't hear that. Representative Craven, we can't hear you. Okay. All right. Representative Stover. Okay. Senator Baldacci.
Thank you, Mr. Chairman. I just want to say that I agree with the prior comments. Representative Collins, thank you for bringing this forward. I think it's an important idea. I think we need to revisit this. I think, though, we need to lay some more groundwork for it before we recommend $8 million be spent. I think that we need to have more, we just need to have more groundwork, I think, done so that we know how this is going to be administered and implemented and done. But I think it's definitely the direction we need to go in order to not only to reduce homelessness, but also to reduce recidivism in our county jails and our state prison. So thank you. Appreciate very much your efforts in this regard.
Any other comments, questions? Okay, Ms. Withy, if you will run the vote. The motion on the floor is ought not to pass.
Representative Zager.
Sorry about that. Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
yes. Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 12 yes, 1 absent.
I think Representative Collins, what you ran into was some of the crunch at the end of a session when some big picture bills that need some more time to be built out haven't really had a chance to mature yet. And the fact that it's a commonly enough recognized problem that we've had a number of other bills that address elements of what you tried to pull into one bigger bill. So thank you for bringing that forward.
Yes, I look forward to working with you on this issue in the future.
Very good. Thank you, sir. All right, so we can go to, oh yes, Representative Connor.
Thank you, Mr. Chair. I know we have a lot of bills today, so I'll be very brief. I believe I missed a vote for LD 497, and the motion was ought to pass as amended. I would like to register my vote, if I may, to yes.
Is that okay, Ms. Withy? You've got that? Very good. So now we can go to LD 78.
So we'll need to take this off the table.
I was going to make that motion to take it off the table for discussion.
Second.
A second. All those in favor, show of hands, taking it off the table. Very good. So that allows us to skip the analysis since we've done that. Was there additional work being done on this since the last time we considered it? There were some questions asked. You want to fill us in on what you found, Aaron?
I don't have the answers to those questions, but I see Molly is here.
Ah, okay. So to you, Molly.
Sure. So there were some questions, I believe, related to fraud of the among EBT card users, and so I'm honestly just going to refer you to the memo related to LD 287, which I don't think we reviewed during the work session, but included and some information about the work that the Fraud Investigation and Recovery Unit and Program Integrity Units do to make sure that that benefits are used appropriately and by the right recipients. And I'm happy to either walk you through some of that information or answer any questions that you have. But otherwise, I would appreciate questions that you'd like to be answered, because
Okay. Representative Javner has one.
Thank you, Senator Claxton. Yes, Molly, I think that the specific question was concerning even just how many families are in non-compliant.
Sure. And let me pull up the number of families who received a full family sanction in the last year. And it would actually be cases.
And also along with that, once you find that and share what the steps are that are taken to bring those families back into compliance and what that rate is of people that are no longer in non-compliance.
Sure. So in 2019, there were 912 full family sanctions applied, and those are individual sanctions. It is possible for one case or one family to have more than one sanction, so that doesn't necessarily compute to 912 families. In fact, I think it's safe to say it does not. The number would be lower, but our folks at there are a number of ways that people can be out of compliance, and our teams at our FedCap Aspire programs reach out to clients in the ways that we have, whether that's phone or by letter, to remind them of their requirements. And it is after those efforts fail that people are deemed in noncompliance when they don't meet the requirements, but we do try to communicate with them. Sometimes families have moved or numbers are out of service, and so or folks cannot leave work in order to make a meeting, and that can put a family without, if a good cause exemption is not filed, can put a family out of compliance. And so there are a number of ways that can happen, but we do attempt to communicate with families, but often these families are those that have a number of barriers to their participation, and so it's when those connections can't be made that some of these kids fall through the cracks.
Thank you. If I may, just to follow up, Senator Claxton.
Please.
And then also too, could you just speak to the report back that has been requested, Molly, if we, for an amendment to this from the department?
Yeah, absolutely. So I will share my understanding, but welcome feedback on that. I think what I spoke with Representative Meyer about was an interim report next January to talk to you about the progress with implementation, and then a report in January of 2023 to talk about the impact on families and outcomes that we had seen so far. So a sort of short interim report to give you a status update next January. The following January, we would give you more numbers about the policy change and what the outcomes have been.
Great, thank you. That'll be perfect.
Great.
Okay, any other thoughts or questions? Yes, Representative Stover.
Yes, I'd like to make a motion to approve as amended and adding in the report back.
I second it.
Ought to pass as amended has been seconded with the language including report back on at least in January's 22 and 23. Representative Lemlin?
Thank you, Senator. Yeah, I just wanted to make a comment. I'm going to vote in favor of this bill because of the report backs, but I'm going to prophesy. I think the department's going to not enjoy this. I think it's going to bring about a lot of problems within the department in the long run. So, but I'm glad the report back's going to be there, and maybe we can make changes once they find out what these problems are. Thank you.
Thank you. Is your hand still up, Representative Stover, or again? We're still not hearing you, but we'll take your hand down. There we go. Any other comments or questions? All right, so the motion on the floor is ought to pass as amended. The amendment being the report back. And just for clarification for me, where do these dollars come from? Are these federal or general fund?
Sure, there are no general funds associated with this. These are all through the TANF block grant from the federal government.
Okay, very good. Thank you. So the motion on the floor is ought to pass as amended. It's been seconded. I think we can now go to the vote. Ms. Withy?
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes. Yes.
Representative Meyer, Yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 12 yes, 1 absent.
Very good. Thank you. So moving right along, we can go to LD 1009, and there's an amendment there.
I can share my screen, but I can't present it, if that makes sense. It's not my amendment to offer, but the sponsor had authorized its distribution.
Sure.
Was this tabled or do we have to bring it off the table?
I don't have it as being tabled, but I will defer to somebody else who knows different otherwise.
This is its second work session.
Okay, so it must be on the table then. So let's start with a motion to remove it from the table
I'll make that motion.
Second it.
and a second. We'll do the show of hands. Unanimous of those present to take it off the table. And now we can begin consideration of the amendment. Thank you all. So we have the screen share. And this changes the bill from mandating an ombudsman position into creating a work group to develop jail resource navigators concept, and with specific membership being described. No legislators. And a follow-up, I believe, on the second page that comes near the end of the year. January 15th of 23. So this one changes it into a work group to design a resource for navigation assistance on the way out of the jail and maybe, or the incarceration, or maybe while you're still in. Senator Moore.
I think this is a great opportunity for you, for the working group to take a look at that almost to the question we were looking at with Representative Collins' bill, and how, when they're getting ready to get out of jail, having everything all taken care of, but we need to have somebody or some navigator in place to be able to do that. So I think this is a great modification to the bill, and I would make a motion ought to pass as amended.
Second.
Moved and seconded. Additional comments? I agree. This is where I was hoping this was going to go. We had a solution without adequate data, I didn't think, from before in the initial bill. So this is an upgrade. All right. Any other comments? So again, the motion on the floor is ought to pass as amended. The amendment is the replacement amendment. Go ahead, Ms. Withy.
Representative Zager.
Ought to pass as amended, yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 12 yes, 1 absent.
Yes, Ms. Dooling.
So when I've shared my screen before, there were a couple of members that I had highlighted the description that I had received when I was drafting the proposed amendment, because I was looking for some greater clarification about what that meant. And I don't know if the committee had any input on that, or whether you'd like me to work with Representative Madigan on that.
I think, why don't you work with Representative Madigan and get it cleaned up for language review when it comes back?
Thank you.
All right. The next item on our afternoon agenda is dependent upon the presence of Anna Broom. If you'd care to introduce yourself.
Hi, I'm Anna Broom. I'm the other legislative analyst for the Health and Human Services Committee, and I work in the Nonpartisan Office of Policy and Legal Analysis.
Very good. So Anna's being here allows us to proceed, if we wait a minute to 3 o'clock, to proceed with the bill 1344.
I just have to find the right screen. I'm sorry. Okay. 1344. All right. Are you looking at that?
We are.
Okay. So this is an act to clarify the authority of the Department of Health and Human Services during a public health emergency. I've spent more time than usual on what the bill does, so I'm just going to go through that. So this bill amends Chapter 250 of Title 22. That's the Control of Notifiable Diseases and Conditions chapter. It's not the chapter where the health inspection program is, which is Chapter 562. So under Chapter 250, the department currently has authority under Section 802, subsection 1, to do these following things: designate and classify communicable environmental and occupations diseases, establish requirements for reporting and other surveillance methods for measuring their occurrence and potential for epidemics, investigate cases, epidemics, and occurrences of those diseases, and establish procedures for control, detection, prevention, and treatment of diseases, including public immunization and contact notification programs. So in this bill, sections 2, 3, and 4 add to that section of the authority for the department the ability to close a business when repeatedly violating public health control measures during an extreme public health emergency, and impose administrative fines. Then the next subsection, the department currently has the ability to declare that a health emergency exists and adopt emergency rules for the protection of public health relating to procedures for isolation and placement of infected persons for care, treatment, or infection control, procedures related to disinfection, seizure, and destruction of contaminated property, and temporary facilities for care and treatment of infected or exposed persons. So sections 5, 6, and 7 of the bill add procedures for the impositions of sanctions, including license suspensions and administrative fines, including a suspension of more than 30 days when operation of the business would result in a serious and imminent threat to public health and safety. So currently Title 5, Section 10004, subsection 3, that's in the APA, allows an agency to revoke, suspend, or refuse to renew any license without a hearing when there is a health or safety hazard or immediate jeopardy, but it's limited to no more than 30 days. So this section notwithstands that, so that the suspension can be for more than 30 days. Current law allows the governor to declare an extreme public health emergency under this chapter, and 37B, which is MEMA, and subsection 3 limits the rules to an extreme public health emergency. So then current section 804 allows the department, local health officers, and all levels of law enforcement to enforce the rules of the department. That section also states that any persons who violate or refuse to obey the rules or hinder the execution of the rules may be ordered to cease and desist, and is not considered an adjudicatory procedure. The department may bring action in district court to obtain an injunction enforcing the cease and desist order, and or to request a fine of up to $500. So section 8 of this bill adds the ability to that section for the department to impose a fine between $250 and $1,000 for each violation of each day of the violation. It increases the maximum court fine from $500 to $1,500. And then Section 9 of the bill adds the ability for the department to suspend a license under the section until a licensee no longer poses an imminent risk, or the district court finds that there is no imminent risk, with the suspension in effect pending court review. So I just think it's useful to know how this bill fits into the current law and how it is only in these particular circumstances. So this is a department bill, and they are asking to strengthen their ability to respond when businesses repeatedly violate public health measures in extreme health emergencies. And they are looking for proposed administrative fines and license suspensions that are stronger than those that are available under the regular health inspection program licensing laws in Chapter 562. So that's why they're in this section, because it's limited to public health emergencies. There is one drafting issue here. I'm just going to go back up if I can figure out how to find my up arrow, which I don't know if I can actually. All right, move myself out of the way, that would help. So I just want to draw your attention back to this section here where it says that the suspension could be for more than 30 days by notwithstanding this Title V section. So in Section 9, which is enacting the license suspensions into that penalty section, a violation under that section allows the department to suspend a license pursuant to that section, which is a power that already exists. However, the 30-day limitation is not, that notwithstanding language is in Section 7, but it's not in Section 9. So that's internally consistent. If you want that notwithstanding language so that the department can suspend for more than 30 days, you would need to put that in both places in order for that to move forward. There was a question about the number of businesses that have closed during the last 12 months period. I don't have an answer to that. I'm hoping that somebody from the department does. That obviously businesses close anyway. I did go around the barn a little bit trying to find somebody else to answer that question for me. I asked DECD and I asked the tourism folks and hospitality, and I got pointed back to the health inspection program, I guess because they have the license information. So I don't know if there's an answer to that question or not. And we haven't yet received the fiscal impact from OFPR.
Thank you. Comments, questions related to that analysis? Representative Javner?
Thank you, Senator Claxton. I didn't even have to raise my hand. So do we have the number of how many businesses were affected? I apologize. Did I see that in here?
No, we didn't
asked
see that,
for it.
but we
The
do.
number of businesses closed.
Yeah, and we're hoping that Molly can give us some idea what that number might be.
Perfect. And when Molly jumps on, I have one more question for her as well. How many outbreaks occurred from the 6 businesses that actually received fines?
Got it. Thank you. And I will ask that somebody move over Michael Abbott and Rebecca Walsh from Maine CDC, who can help me answer that first question. And they may be able to answer that second question, but I will get working on that in the meantime.
So they're being moved over. So we're joined by, should we go right to Michael Abbott, Molly?
Sure, Mike can.
Welcome, Mr. Abbott. Want to introduce yourself?
Thank you, Senator Claxton. Hello to the members of the committee. My name is Michael Abbott. I'm the Environmental Health Director with CDC. My division includes the Health Inspection Program. So I'll do my best to answer these questions. And Rebecca Walsh, our Health Inspection Supervisor, is also here with us, and she can add in whatever I miss. So to answer the question about business closures, we have a list of the businesses licensed by the Health Inspection Program. And in 2020, there were a total of, well, before I give the number, this includes businesses that close for any reason, and businesses do close on a regular basis. So in 2020, that was 734. To give you an idea of how significant that was, in 2019, we had 655. close. In 2018, it was 736. 2017 was 532, and 2016 was 660. So it seems to range between 500 and 730 something. So, we certainly, businesses did close for various reasons in 2020, and that is the highest number. No, it's not. It's the second highest number in the last 5 years, but it's certainly within the range of what we think is normal.
Thank you for that. Did you have a follow-up question, Representative Javner, specific to the businesses closing?
No, not to the closures, but to the ones that were fined, which
Yeah.
ones originated any outbreak.
Sure. So let's hear from Ms. Walsh about what she can tell us about that.
Okay.
Oh, go ahead, Mr. Abbott. Did you want to keep going?
Well, let me answer, and then Becky can, if
Okay.
that's okay with you. I
That's
do
fine.
have an answer for that.
That's fine.
As apparently Representative Javner, there was six businesses that received fines for operating under a temporary suspension. Now, to answer your question, the reason that we identify imminent health hazards and close or suspend licenses if necessary is to prevent, in the case of COVID-19, was to prevent outbreaks. So I don't think there's any way to identify which of those businesses may have caused an outbreak if we hadn't taken action. So I don't think we have a definitive answer to your question. And in terms of which businesses are linked to outbreaks, that information would probably be contained within our epidemiology team, which is a different division in CDC. Offhand, I cannot say which businesses that we took action against did or did not have, or were not associated at some point with outbreaks. But again, the whole reason we take that action is to prevent that from occurring. Would you like to add to that, Becky?
Sure.
Please join us.
Good afternoon, members. So I am aware of, off the top of my head, I'm aware of one establishment that we find that did have an outbreak right around the time that we issued the imminent health hazard and temporary suspension of license. And Mike is correct. It's as far as the other establishments, we don't have that data. That is something that our epidemiologists would have better information on, if there were subsequent outbreaks or if there were outbreaks associated with any of those other 5 establishments.
Does that get closer to what you're looking for, Representative Javner?
Yes, thank you very much, Senator Claxton. I can appreciate the work that the CDC has and the effort that they have put forward in this to keep everyone safe. I just think that there are so many variables out there that for, certainly raising the fine, doing the measures that this bill, brings forward. I don't see the reasoning for that. There was, no evidence of, the outbreaks, no evidence of, even if they hadn't been fined, if they hadn't had, closures, that nothing else would have happened. There's just, too many variables. And I think we're going to be learning more information even further out as we continue to look backward into 2020. So thank you.
Thank you. Representative Craven.
Thank you, Mr. Chair. Well, I'm sure we all remember the wedding in Millinocket where at least 8 people died.
We just lost your audio, Representative Craven. There you go.
So I was talking about the wedding outbreak in Millinocket where at least 8 people died as a result of them not following the rules, and wondered, in cases like that, were they fined or sanctioned for not following the rules?
So I can answer that. They were not fined, but we did issue an imminent health hazard, and I believe we issued a temporary suspension of their license. Initially, the first temporary suspension is for a shorter period of time, and for up to 30 days is what we can issue it.
Thank you.
And in that particular case, can you speak to whether there were additional suspensions beyond the first one?
There were not. They, once we did the investigation, I believe, and we educated them and got them on board with becoming compliant with the COVID-19 prevention checklist and the governor's executive orders. I don't believe we had any other issues there.
Great. Thank you. Representative Connor.
Thank you, Mr. Chair. Just reading through this, Mr. Abbott, how many were repeat offenders? I don't know, maybe I missed it somewhere in there, but were there a lot of repeat offenders that are requiring this bill to have more strict measures or more power, if you will, to the department during COVID?
Thanks for the question, Representative Connor. Well, I don't know exactly how much of the information you have in front of you, but we issued 93 imminent health hazard findings. That's not enforcement. That's a finding that there's a condition that needs to be addressed. We issued 23 suspensions. And as we talked before, we received, we issued fines to 6 establishments for operating with a suspended license. I think the need for, I guess, a little more teeth, if you will, in this law was that we did have occasions where we can issue a temporary suspension, but that license gets renewed automatically at the end of the suspension period up to 30 days. We did have cases where establishments continued to refuse to follow any of the COVID-19 prevention guidelines and continued to operate. And we, the fines that we were able to issue were apparently, within the cost of doing business and not enough to persuade them to correct their behavior. So, in a way, it made it very difficult to correct a situation that we felt was very dangerous to the public and could result in a super spreader event, if you will, or at least spreading the disease among patrons and staff. And so that's, and also the only the ability to suspend a license and not to issue a cease and desist was also a hindrance. So that's, I think, the general reasoning behind what's being asked for in this bill.
So if I'm understanding you, I'm sorry, Mr. Chair, follow up.
Please, no, go ahead.
So is that in succession, the numbers you gave? So you started out with 93. Of that 93, 23 violated again, so therefore you had to go to the next corrective action measure. And then of those 23, 6 more repeated offended and got the actual fines. Is that how I'm understanding that, or am I understanding that differently or incorrectly? Well, I apologize.
Yeah, I think you're interpreting it correctly. However, in some cases, businesses were issued more than one temporary suspension or more than one imminent health hazard, and more than one set of fines. So those numbers aren't exactly, but that's kind of the general progression. Is that to start with, we followed up on over 4,000 complaints on businesses. So of those, we only issued 93 imminent health hazard findings, and that was less than 93 businesses because some were repeat offenders. Those that continued to receive complaints, we continued to find out a compliance that would progress to, yes, temporary suspensions, and then operating without a license after a suspension was issued would progress to the issuance of fees. And I think, out of all of those, only one of the businesses was eventually forced to close for a longer period of time than 30 days.
Thank you. And then my last one, Mr. Chair, if I may, how many total licenses are there in the state of Maine that are issued by the department?
That's a question for Becky.
Over 10,000. The health inspection program licenses eating establishments, restaurants, youth camps, public pools and spas, 4 types of body artists. And of those 12 license types, we have over 10,000 licensees.
Thank you. That's all I have, Mr. Chair.
Thank you. Representative Jadner?
Thank you very much, Senator Claxton. I just want to address the business earlier that was mentioned by my colleague. I think that, you know, those desks, nobody had, of course, we all remember that. I have spoken directly with the owner of that business, and I think that it's at this point, I think, as I said, we're going to learn more as we move forward. And I think, you know, there are outbreaks happening in nursing home facilities even right now, more than what we want and what we consider. And so I think that as we continue to talk about, you know, what has happened, that we remember that these are real people and these are real industries that, you know, their lives have been altered because of what has happened. Thank you.
Any other comments? I'm glad Representative Connor asked a question about the total number of licensees. That was one I was going to ask. So we're talking about a very small subset of folks who couldn't get right with the rules. Okay. And it's less than 23 because there were repeat offenders, as I understand it. Okay. All right. Any other comments? Does anybody want to make a motion at this point? Yes, Representative Craven?
Thank you, Mr. Chair. I move ought to pass, and I think it says amended. As amended.
Anna, is there any amendment?
If you want to straighten out the inconsistency with the 30 days, yes.
Yes, please.
So is that a change that you wanted to make, Representative Craven, so that the 30-day language was the same in both places?
Yes, please.
So there's been a motion ought to pass as amended. Is there a second?
Second.
Been moved and seconded. Are additional comments, questions? Representative Lemlin.
Yes, thank you, Senator. Yeah, I just have a comment, and that is I'm going to be not to pass because I'm going to stand up for myself as a business owner and the other 10,000 business owners that I know want me to stand up for them. This reminds me of George Orwell's 1984, and I'm not in favor of that, but thank you.
Any other comments? Not seeing any, we can go to Ms. Withy for the vote.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover. Representative Stover is absent. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 5 yes, 5 no, and 3 absent.
Thank you. So the motion, as far as we know, doesn't carry. We'd have to hear from the other 3 votes before we can decide whether to entertain an alternative motion. And we also can't determine who's going to file a minority report. because we haven't got a minority. So it looks like there's more work to be done. We have to wait for the votes to be registered with Ms. Withy through the presiding officers to figure out whether we need to reconsider this issue or not. Okay?
Can I still have
Please.
the other motion though, or the other report?
So it's not considered a minority report, it's considered the other report for right now.
It would be ought not to pass, Emma.
Okay,
Thank you.
thank you. All right, so that brings us to consideration of LD 1147. And
Actually, Senator,
sure, yes.
that was LD 1344.
Right.
Okay.
That brings us to consideration of 1147.
Okay, I'm sorry.
All right, hopefully you are looking at my screen. This is a resolve to enhance access to medication management for individuals with serious and persistent illness. This resolve provides for a 25% rate increase for the medication management services provided under Section 65. It also requires the department to develop with stakeholder input a per member per month rate with 3 tiers to reflect increased demand and complexity. The resolve also includes an appropriations and allocation section with 1.5 million in general fund in each year and 2.7 million federal funds. You heard at the public hearing from the sponsors and the proponents that they cannot wait for a rate study, that this is a basic foundational service for serious and persistent mental illness to follow reactions to medications and side effects. KBH lost $500,000 last year on this service, and they have 400 on the wait list. And you also heard that they would like the stakeholder group to develop a per member per month rate with 3 levels of reimbursement to recognize varying complexity in the same way that is apparently used in opioid health homes. The department said that the rate study evaluation shows existing medication management rates are higher than rates in comparison to other state Medicaid programs, so they are recommending a rate study. And medication management rates for physicians in particular, or rather specifically, were increased in 2020 by 14.25% for adults and 7.52% for adolescent or children. That was in the supplemental. This is an emergency bill, but there is no date for a rate increase or for rulemaking to begin. And the other thing that I noticed is that the bill states that the rates will increase by 25% with subsequent, now I can't see where the language is, subsequent adjustments to ensure that adequate resources continue to be available. I don't actually, oh, it's the number 1 underneath section 1. I don't actually know what that means. I don't know if the intent is a COLA or something else, but that wasn't entirely clear to me what that language means. And we haven't yet received the fiscal note from OFPR yet. I do just want to mention that this bill does have an appropriations and allocation section in it. That doesn't mean that when Luke comes back with his preliminary fiscal, that it won't have different updated numbers, but there is an appropriation in it right now.
Thank you. Any comments or response to that analysis of LD 1147? Questions, concerns? Yes, Representative Perry.
Yes, I understand that the department is already doing some looking into the payment methods. And I also feel that if that is going to happen, it has to happen on a much broader level than just looking at one section of the services. So I would like to maybe recommend an amendment to the bill where we leave out the study piece of it. And, or not the study piece, but the per member per month thing that they're trying to look at, and just do the appropriation for the, like our other rate bills, put that in so that can be looked at along with everything else, just the rate change.
And you mentioned broader. Does that mean broader in terms of providers? So it's more than just physicians?
It's all providers. I think if you're looking at agencies who are working with behavioral and mental health, it is not just one provider at a time. It's the full service. And I think that looking at that, and that's more of what they did with the health home as well, is that you look at that as a whole service.
Okay. Senator Moore, you had your hand up.
Yeah, just one clarification. I think I know what it means. That we're trying to figure out what exactly is medication management services. Somebody can help me with that, understand it.
This is the part of mental health I'm not that fond of. Because we separate medication from counseling, we separate the surround on mental health. Medication management is the person who actually prescribes and follows the medications.
Okay. Thank you.
And looks for interactions and tries to identify if there's something about the individual that needs special attention, adjustment of dosing. Certain medicines will react differently initially versus long-term, require adjustment. And so that's looking at the big picture of the person and the medicines they're taking, as opposed to the one or two I'm prescribing if I'm a mental health person. Got to make sure that we're not screwing up the thyroid and the hypertension and the diabetes. Is that a fair summary, Dr. Zager?
Yes, Dr. Cox.
You had your hand up for a question, did you?
I do. I agree with Representative Perry. I'm not sure if that was a formal motion, but I philosophically agree that there are other bills that we're considering. For instance, Senator Breen's bill that look a little bit more comprehensively at the mental health system, and so I would also be in favor of keeping the rate increase, but striking the piece that deals more with the PM per member per month.
Okay. What about any other questions? What about the keeping pace or cost of living adjustment question? Is that something we want to include in the bill? Senator Moore.
Didn't we have some words that we included in a previous bill that addressed, that kind of tied it in with the federal or the Social Security COLA or something? I can't remember exactly.
You can do that if you want, Senator. It just currently just says that it would subsequent adjustments to ensure that adequate resources continue to be available, and that's meaningless to me. But if you want something that reflects COLAs, you can certainly do that.
That's where I took it, because I don't know what other resources we can adjust in legislation that would guarantee access. All right, so there's some sentiment. So you can find you could find the language you used before in a previous bill about cost of living adjustment, right? As CPI or.
Right.
Yeah.
I also just want to make sure that you are if you're moving forward with this, that you're intending it to apply to all medication management. The only reason I ask is because there were some increases to physicians 2 years ago.
Right, and they got the 14+%. Yes, Representative Griffin.
Thank you. I'm just, do the other rate reimbursements also look at the COLAs, or I'm just.
We've sort of been doing it. The last time we used that language, as I recollect, was in the allowance for people living in a nursing home or residential care when we went from 50 to 70 and added a COLA, or 30 to 50 and added a COLA. So it doesn't necessarily have to apply at all. I'm not invested one way or the other. I was just asking if, according to what I understand from the department, they're going to be on a 5-year cycle for reevaluating. But we're not sure. There's no guarantee that's going to happen. Yes, Representative Lemla.
Representative Zager was ahead of me, Senator.
Oh, okay. Thank you, sir. Representative Zager.
Thank you, Mr. Chair. I think that it is important to increase for all prescribers and med management, mostly because the system is failing to provide people who are able to account for, provide that service. And so that's addressing a question from a few minutes ago. All right.
Mm-hmm. So Anna, can we write this such that we adjust all the rates up 25% from the year prior to the 14.25% increase? That happened in 2019, I think, 2020.
However you want to write it.
Well, I'm asking, could we state it to bring everybody up from the 2019 rate to a uniform 25% across the board increase?
Yes, if you want to do that. You're just saying that the rates for physicians would be going up partly, not
11%.
but getting to 25% in the end. Yes, if
Yeah.
you want to write it that way, we can do that.
Okay, thank you. Representative Lemla.
Yes, thank you, Senator. I'm a little confused. If you could help me, are we talking about raising the rate for any physician that deals with individuals with serious and mental illness, or just for the medication management part?
It's just medication management. It's just that there are different providers that provide that service. And so the physicians that provide that service got a raise a couple of years ago. And this bill would apply to anybody who provides that service, but only for that service.
Okay, thank you very much.
Representative Perry.
Yeah, the idea of, first of all, the sentence about resources. I guess the question I have is, if we're going to do ongoing raises, I think we need to allow the department to look at that across the board. And again, instead of just one thing. And if they are really looking at and sticking with a 5-year review of a lot of these things, that is, I think, when we should be doing that. But because if we start picking and choosing which one does what as they come up, we're going to be all over the place again, and we're going to be doing this forever.
Right. There are 15 rate bills, at least 15 rate bills that we've heard or will be hearing before we're done with this session. And some of those might be better vehicles. Some of those are going to have different numbers attached to them. One was 39%. That was Representative Stover's. Another was 25%. And I think at some point we're going to have to roll these things up and decide what our priorities are in order to give AFA some clue about what HHS has been thinking about these rates. We'll see if Mallory Shaughnessy can answer any questions about this for right now. Welcome, Mallory. Do you have any feedback that might be helpful when you unmute?
Oh, there we go. Hi, sorry, I'm sitting on the side of the road in my car.
Good,
At the doctor's
side of the
appointment
road.
myself. I just wanted to share that in part this bill came out of an assessment that we did within the behavioral health field around which services we were losing more rapidly. So who was having a harder time? What were the wait lists building? Who was having a harder time getting into a service? And what were some of the foundational services? And medication management is very foundational. If you have severe and persistent mental illness, is being able to have somebody following your medication that you're on, for both children and adults to assure stability there, so that you can have your community supports, your community therapy, your outpatient therapy, and those types of things, and don't escalate up into an emergency room visit again. So, I know you're talking about different, rates. We tried to bring forward just those rates that were really at the pinch point of losing the services. This being one of them. And you heard from, I think, one provider who lost like $500,000 doing the service. I know other providers have lost definitely tens of thousands, if not hundreds of thousands as well. But they keep doing it and trying to float it with other resources because it's such a foundational service. It has to be there. But we fear we're losing it. I know Sweetser just ended up dropping 700 individuals, and we had to scramble to find other providers for them because they just were losing too much money. So that's where some of the bills that we brought forward came from, just those ones that couldn't wait really any longer. And the piece about increasing it, the department has been saying that every 5 years they will start trying to review these so that we don't go decades, and that periodically there could be a CPI increase within a 2 to 3 year frame, that they're going to adopt that. So that language is sort of alluding to that type of a system. And I'd be happy to answer any other questions. The issue about who does this service, it is predominantly done within main care by psychiatric nurse practitioners and physician's assistants, because we just can't afford physicians and psychiatrists to do it. And even though that rate went up, there's not enough of them to hire. So that rate increase we got a few years ago or a year or so ago didn't really help because it's not mostly done by those providers. So just a little explanation.
Thank you. Thank you for that background. Yes, Representative Zager.
Thank you, Mr. Chair. I'm sorry, I think I missed a little bit of that, Ms. Shaughnessy. Where did the 5 years come from? Why is that it seems like if we're already kind of way far behind, it seems like 5 years might be a bit far out to.
Right, that's our concern, is that the department is saying that with this new rate evaluation process, they are hoping to start doing 5 year reviews on a regular basis with periodic, 2 to 3 year updates just based on CPI and not a full rate study. But it has been basically, a decade for most services since there's been a rate study. The rate increase we got a couple years ago, just for the physicians only, didn't really help within the main care group of providers because they primarily do not use psychiatrists or physicians because there are not enough of them doing this. They use nurse practitioners and psychiatric nurse practitioners and physician's assistants who did not get the increase, and so they still are losing money trying to provide this foundational service. Most private physicians do not really want to do psychotropic medication management. They want to hand that over to the specialists or people that do that as a regular basis.
Thank you. Does that answer your question, Representative Zager?
Yeah, no, I understand the second part. I really appreciate that. But I guess I'm just wondering why we're anchored to 5 years. Like,
that's just something the department has stated that they want to do moving forward. We're saying, one, we can't wait another year on this one. We've been asking for it for a couple of years. And yeah, we would rather it, Colorado, they do an annual review. In Colorado, all behavioral health services are done annually. It's a cost study report. What did you spend? What did you see? And they tally it up every year to keep it, the adequacy of network, which is actually mandated by the Social Security Act, is an adequacy of network to assure access across your state, which we don't have right now.
Mr. Chair?
Yes, please.
So I guess that's I guess where I'm going with this is that I don't understand why we couldn't do have an annual COLA adjustment. I mean, if COLA cost of living changes, we either accept that we're going to underfund something that is already taking on a lot of water, or taking, it's like a sinking ship, already taking on water fast, and we're only going to reassess how fast we're taking on water, every 5 years. I guess since the data is readily available every year. That's published by the federal government. I guess I'd be more in favor of an annual adjustment.
Okay. Okay.
We'd love that.
Any other thoughts? What about a date for this? Anna asked about or pointed out that there wasn't in the bill any delivery time for this.
I think just the emergency nature of it was that hoping that it would happen as soon as the session ended.
Okay, so that will be addressed by the emergency clause. If
That
we can
makes
get
the
that.
bill go into that makes the bill go into effect. It doesn't make the rule be made immediately.
Because there's the lag time for the rewriting rules and reprogramming computers.
Right, and I think that there's a potential to do it backdated. So if once they get the rule done, it can be retroactive to like the new fiscal year, July 1 type of thing, I believe.
Okay, so we pass an emergency preamble and we'd make it effective as of July 1st. Whenever they get done with the process, it might end up being retroactive. Okay, does that make
That's
sense?
how they've done a number of other things, I believe.
Is that workable or something you can work with, Anna? Yeah, okay. So that takes care of the date question. Any other thoughts about the COLA, cost of living adjustment? So I've heard one person say they think it's a good idea, another person not so sure. Okay. And then what do people feel about the adjustment, changing it to 25% increase based on 2019 to get everybody the same 25% increase? Yes, Representative Perry.
I was just responding to the COLA. I think it's a good idea, but I really think we should be doing it more broadly if we're going to do it. And again, I just worry about we're going to end up with this up and down and up and down and up and down and be dealing with this all through. So if we do rates, if we're going to talk about rates, then let's do the COLA with them all.
We've only voted on 2 of the bills so far, according to the sheet I have. It may be a little outdated. So we may have maybe half the bills, but we could reconsider and add a COLA to everything if as we go along, if you want.
I don't mind doing that. I think we've really got to look at the fact that we're failing in mental health, and we are at the point of possibly another court decree around mental health because we have been failing. I think we really need to send a message.
So do you want to make that in the form of a motion?
I move.
So you're a big help. So I heard a motion ought to pass as amended. The amendments that we've talked about are to change the rate increases from 2020 data to 2019 so that everybody goes up 25%. We've talked about keeping the emergency clause and then making the effective date July 1 of 2021. There's been some sentiment for inclusion of a COLA, which is, since you're making the motion, will include something. All right. And that it apply to all providers, not just the 2 that got the raises last time. And it removes the study part of the bill and setting up the various tiers. That's my understanding of the amendments. Okay, so I see a nod. Is there a second for that motion?
Second.
There's a second. Is there additional discussion of that? So I will turn to Ms. Swithy and have her run the vote.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
I must say I'm a little dizzy, but yes.
Representative Lemlin, yes. Representative Stover. Representative Stover is absent. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
Okay. I propose a break until 4 o'clock. If it was up to me, we could quit now, but Senator Moore has told us that we need to keep working so she can get out of here a reasonable hour tomorrow. So I'm proposing a 10-minute break until 4 o'clock. Anybody object? How's it feel under the bus there, Senator Moore?
Senator Claxton, could you just go over the numbers that we'll be addressing as when we return? I've had a few.
Sure. Sure. The next ones will be 1263.
Yep.
488. And 1325.
And that'll conclude our afternoon.
That seems like enough to Senator Moore, so I'm ready to quit.
Thank you.
All right, see you at 4. So we can review or resume our consideration of the remaining 3 bills for this work session. Just for the record, Senator Moore was giving me a bad time yesterday for things I did, so this is just payback. Respectful payback.
Teamwork, teamwork. That's what it is.
Teamwork, that's right. Teamwork. All right, so that gets us to consideration of LD 1263. And we've been joined by Senator Diamond. We'll hear from the analyst first and then give an opportunity for some follow-up from the committee and then the senator.
All right, this is an act to create a separate Department of Child and Family Services. This bill creates a new Department of Child and Family Services by transferring the functions of the DHHS that relate to child and family services and child welfare to the new department. The Department of Child and Family Services will have a commissioner appointed by the governor and confirmed by the legislature, as is the current commissioner. The new DCFS would take effect July 1st, 2022, and the bill establishes provisions for transferring functions to the new department. So there were some discussions during the public hearing about what would be included in a separate department. There were questions about, well, a child protective was an easy part of it, but whether it would be all of child and family services, whether it would include mental health, maternal and child health, whether it would include childcare, children with DD and autism, there were some concerns there about whether those children currently get lost within the behavioral health system. So there were some conversations around what exactly would go into the Department of Child and Family Services. There was certainly some proponents that would like additional resources that go towards child welfare, that although it's a small number of children, they need outsized attention. And you heard about the 2020 Ombudsman report that still has some concerns about child safety during initial investigations and reunification. There was some talk about the idea of a work group to study the benefits and challenges to be considered in developing the new department. And you heard from the department that OCFS has no significant concerns about the department's current structure, that they would need to do this. It would require new accounting codes, state plans, federal grant programs, funding streams split between officers, oversight, and programmatic splits. So this Title 22A, which is a really short chapter, really short title, is DHHS. This bill establishes another very short chapter of 22B. You could have separate subchapters within 22A, but the reason it wasn't drafted this way is because there were a number of references to this title in 22A. So if you were going to divide it up, you would probably want 2 subchapters and sort that out. July 1st, 2022 for the department becoming operational seems quite quick, given the work that would require for the transitional requirements of Part B. It does require legislation by the department to establish the responsibilities in transitions, that you would need to clarify the process for when that new department would be in place and what that interim process would look like for establishing the transitions. You did, I don't know whether Molly has this or not, but you did ask for a history of consolidation and breaking apart of the department, what prompted those changes and what were the results, and how the changes in funding streams between offices reflect those priorities across time. What I can tell you is that Public Law 2003, Chapter 689, created the current Department of Health and Human Services from the Department of Human Services and the Department of Behavioral and Developmental Services, BDS. That was much more straightforward drafting because it was more of a renaming of the department than breaking them up. But that merger did take a number of years to do. There was more legislation in 2008. And then but then that was putting any responsibility of either department into DHHS, so the drafting was a little bit more straightforward. And then Public Law 2011, which was in part of the supplemental budget in 2012, restructured and took the names of the officers out of statute. These are some of the old names, and part of the reason they did that, for example, with the Office of Behavioral Health is a perfect example, that they were able to go ahead and change their name without having to come and change a whole number of references in the statute. So that was just some examples. Whether Molly has more about the consolidation and the breaking apart and why those things happened and so on, you would have to ask the department.
Very good, thank you. What kinds of questions does this raise for any committee members? Issues, comments, thoughts? Representative Perry.
Yeah, I mean, my thoughts are when we went through the period of time of merging the departments. And part of the reason for merging the departments is that there were very significant silos that were set up. Communication was not good. And actually, there were times when families had services from each of the different departments that they had, and one department was not talking to the other. And they were separate silos at that point. The reason of putting that all together was to really help with communication that went further in terms of looking at coordination. And I do remember times when it was much better, but unfortunately, whether it's a department or not, what happens at the top affects the results of what happens at the bottom. And we've been through a very political time where things were split apart, and we lost a lot of staff that has affected the work that's been able to be done. So I've got to say this because I respect Senator Diamond greatly for the work that he's done. But I firmly don't believe that separating a department is going to make the work down on the level that we need to have it work, is going to make that.
Thank you, Representative Perry. Representative Craven, you had your hand up.
Thank you, Mr. Chair. Hi, Senator Diamond. It's nice to see you here.
Hi, nice to see you.
Thank you for all the work that you do, and enjoyed your book, and I still have it. I agree with Representative Perry. I think that, actually, I don't know if you know Todd Landry, but he hasn't been here all that long, and he's been working diligently to improve the department, and he's been doing a lot of work, which is no small task, I think. After the initiation of the last few years, and that we should give him a chance to do his work and to finish a lot of those initiatives that you have brought up as well. So I just wanted to say that and to thank you.
I don't see any other comments from the committee. Senator Diamond, did you have any thoughts after hearing from Anna and the committee?
Yes, first off, thank you for the serious consideration, and I especially enjoyed. I didn't enjoy, but I was pleased to be able to present my case to the full committee at the public hearing, and your response and your reactions were greatly appreciated. The sincerity from which that came. I want to say just briefly, this is not a reflection on Mr. Landry or the commissioner or anybody else, and I've said that from the very beginning. What really eats at me, and I've learned over and over and over since 2001, when Logan Mara was killed in such a brutal way, that everybody had the best intentions. And the reason that the department joined HHS and Behavioral and Developmental Services in 2004 with LD 1913, Governor Baldacci signed that into law, was because they were looking for an answer to a correction to a problem that was almost beyond them. But that seemed like a good thing to do at the time. But the problem is it's not the people, it's the structure itself. And then more kids, unfortunately, died along the way. And each time, well-intentioned people said they were going to fix it, and it doesn't get fixed. And then we saw the most recent terrible cases in 18 of Marissa Kennedy and 17 of Kendall Chick. And as I mentioned at the public hearing, I attended all those hearings, those trials, and the sentencing hearings that went with it. I apologize for that. And you could, when you see the details of what happened, and you see where maybe just a couple more visits would have saved these kids' lives, because the evidence was so brutally visible and available. So it's just been ongoing, and I think what's going on now in the department, I suspect it's much better. But if you remember when the Kennedy and the Kendall Chick tragedies happened, the first thing that we all wanted to do, or what at least what the administration wanted to do, was to hire 70 caseworkers, and that came before the government oversight committee, which I was serving, and it was a sincere effort, but it was too little too late, and the training that goes with that, we all know it's much more complex. My bottom line is, I know that this is not the best answer, but I would have an awful lot of faith in this committee if there was something this committee would take away from this and do something a little more examining. I mean, I expect the department to say they've got it fixed or they're well on the way, but that's what they would say, and you would hope that they would say that. I would hope that you as a committee would find a way to actually take a review and a closer look at what's going on before unfortunately unintended another kid dies. And it's such a huge bureaucracy. I just think it deserves another look, because if something, God forbid, happens again, as it's been happening since I've been involved since 2001, then we're going to say, oh my God, we got to fix this. We got to do something preventative, proactive. Maybe you could do something as a committee over a little longer term to take a closer look at what you see, not what someone else tells you, but what you actually see. And I think that's what's been missing. We relied on the departments over the years. There's been 4 government administrations and at least 7 commissioners, all with the best intentions. But I don't know that we've ever had a good legislative look at this, at least this committee that you all serve on. And so that's my plea, that we would take a closer look at what's happening, hope that what we're hearing is true, but take a closer look. And you looking at it would give me a lot of comfort.
Thank you, Senator Diamond. I see Representative Lemlin, you had your hand up.
Yes, thank you, Senator. Senator Diamond, I'm in favor of your intentions here, but I haven't been on this committee very long, but what I've seen of Dr. Landry so far in his work, I think he's on the right track. I agree with you that he's on a difficult road, and it's going to take a lot of work. But I think this committee is doing what you're asking. I think we are reviewing it, and we're trying to do our best to make sure that Dr. Landry and his team do stay on the right track. I'll make one additional comment. If you want to get rid of our current CDC and come up with a new department, I'm all in favor.
So other thoughts, comments? I've had some conversations with folks about instituting some reviews on a scheduled basis that would also include the ombudsman, and hear what they can tell us about how the department's doing. Any thoughts about periodic updates and hearings more formally? Yes, Senator Moore.
Well, Senator Claxton, I was just reflecting back on our conversation earlier today on LD 497, where we actually included in there report backs. You know, we had interim report back, and so I think we've already asked that of the department, and I feel very confident with Dr. Landry and the strategies he's using and the implementation and the priority he is giving to child abuse, because we know it's something that is very, very important for us to keep front and center. It's my comment.
Yes, thank you. Any other comments? And the thing we didn't include there, though, was, and certainly can without legislation, is getting the ombudsman back in around the same time to get a outside opinion. So that's something we could readily do. Any other thoughts about LD 1263? I think I think it's clear what's at the heart of the intent, and I use the word heart advisedly. And I think all of us on the committee are attuned. But we don't know what we don't know. So asking some other folks at various stages to help review what we should know and what the opportunities are would be a great idea. Yeah, Senator Moore.
Yes, thank you, Senator Claxton. And I thank Senator Diamond for bringing this forward to us. It is, a very important issue with that. But with everything going on right now, and I want to give the department the opportunity, Dr. Landry specifically. So I'm going to make the motion of ought not to pass LD 1263.
It's been moved and seconded, ought not to pass. I will, just for information purposes, update Senator Diamond on a bill we did consider earlier, and we'll be getting regular follow-ups in terms of how things are going with primary and tertiary prevention in the arena of child protection, both prevention and further down the road. So we have 6-month follow-ups pretty much scheduled for that, or 1 year starting in January, but at interim, how is it going meeting before that. So there are several meetings, gatherings in place that would update us on how the department was doing with its efforts. And that was part of our conversations earlier today. So there's a motion on the floor, ought not to pass. It's been seconded. Is there any additional discussion? So we'll turn to Ms. Withey to run the vote.
Representative Zager.
Yes.
Representative Zager. Yes. Representative Lemlin.
Yes.
Representative Lemlin. Yes. Representative Stover.
Yes.
Representative Stover. Yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry. Yes. Representative Griffin.
Yes.
Representative Griffin. Yes. Representative Connor.
Yes.
Representative Connor. Yes. Representative Craven.
Yes.
Representative Craven. Yes. Representative Madigan. Representative Madigan is absent. Representative Javner.
Yes.
Representative Javner. Yes. Senator Moore.
Yes.
Senator Moore. Yes. Representative Meyer.
Yes.
Representative Meyer. Yes. Senator Claxton.
Yes.
Senator Claxton. Yes. That's 11 yes, 2 absent.
So we'll be hearing back from the department about how they're doing with their efforts on a regular basis, and including some conversation with the folks from the child welfare ombudsman. I'm hoping that's enough of a step in the right direction that will be a more active oversight committee than maybe has been in the past.
Thank you very much for your time, and I really appreciate the thought you put into it. Thank you.
Thank you, sir, and have a good rest of the day. So now we should move to consideration of LD 488.
Yeah, they just killed it.
All right, LD 488. This resolve provides expedited funding in the amount of $1 million total for 21-22 and 22-23 fiscal years through a competitive RFP process to recovery community centers located in Franklin, Hancock, Kennebec, Piscataquis, Somerset, Waldo, and York counties, serving individuals with substance use disorder. You heard during the public hearing that there's been an increase in recovery community centers in recent years, and there are 4 more opening or getting ready to open, and there are currently a total of 13, but only in 9 counties. You heard a lot of testimony from people in recovery about this evidence-based service that they would like all people in recovery to be able to benefit from. There was some disagreement with testimony about what constitutes a recovery center. For example, the link in Augusta is in Kennebec County, but doesn't fit the definition of a recovery community center as established in the bill. My understanding about those is that the link is part of the motivational services, the MOCO contract, and they are funded as a mental health peer recovery center. So I think that's the difference with what the sponsor is looking for in this bill, and some of the testimony around those other, whether there are recovery centers in Kennebec County, for example. There is an amendment available from the sponsor, which you have received. I don't know if she's here, but I do know that you have received the language, so I can pull that up if you'd like. You received the map of recovery centers that was emailed to you. I can also pull it up on my screen if you want to see it. The OFPR preliminary fiscal impact statement is based on the original bill, so that's $500,000 in each year. That does have an appropriation number that is no longer exists and would need to be changed, but I don't think you're going down that road at this point anyway. And I can bring up the language at any point when you, I do see that the sponsor is here. So I can bring up that language whenever you'd like, but I assume you'd like to hear from her first.
Any comments so far from the committee? So welcome, Senator Maxman.
Thank you, Senator Claxton.
Any questions or points you'd like to make after hearing from Anna?
Yes, since the public hearing, I have met with the advocates and the department to come up with the amendment that you have before you today. In our meetings with the department, they told us that they are planning on building multiple recovery community centers across Maine already, which was information that I hadn't had before, but was really excited to hear. And so what this resolve does is ask the department to take regional distribution into consideration when they're allocating funding for these new centers that they're going to build, to prioritize the counties that do not currently have state-funded community centers or other recovery community centers. This is an amendment that was asked for by the department and okayed by them. And so I think it should be good to go. I know I know that Courtney Allen is here, one of the advocates, to speak about the importance of this, if that's helpful, but I can stop there.
So did you want to put up the amendment, Anna, just so we're all literally on the same page?
Yep, you should be able to see that right now, I believe. You probably can't see all of the emergency, but it does have an emergency preamble on it, since the understanding was that there are recovery centers that could open quite soon, so this would make it go into effect immediately upon enactment.
So this should seem somewhat familiar to members of the committee. Since we got it, does it raise any questions or concerns? Yes, Representative Perry.
I would like to move LD 488 with the recommended amendment.
I'd second that.
So it's ought to pass as amended. And it's been moved and seconded. Is there additional discussion? There being none, as long as Ms. Allen, Courtney Allen's here, did you have something you want to contribute?
No, I just want to thank the committee for your work on this bill. I've been in contact with all the advocates who worked really hard and came before your committee, and we are very pleased with the compromise that we've come up with the department, and hopefully your committee will vote out to pass as amended. Thank you so much.
Thank you. Senator Moore.
Yes, thank you, Senator Claxton. I just want to confirm there's actually no fiscal note with this. Am I correct? We're not asking for any monies. Okay, we're just asking for the RPs to, okay, excellent. Great, because Washington County, I know we're slim going, so that would be excellent. Thank you.
Any other comments or questions before we vote? So the motion on the floor is ought to pass as amended. The amendment is the change. The new amendment is the change. Okay, so we'll go to Ms. Withy to run the vote.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci, Senator Baldacci is absent. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan, Representative Madigan is absent. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 11 yes, 2 absent.
So thank you, Senator Maxman, for your various and ongoing efforts to get this where it was a really good spot. So appreciate those efforts and those from Courtney Allen. So progress. All right. That brings us to the last of the bills we're intending to cover today. That's 1325.
All right, this is an act to provide relief from audit requirements for certain healthcare facilities during a state of emergency. This bill prohibits the Maine Health and Higher Education Facilities Authority from requiring certain healthcare facilities to file audited financial statements or reports with the authority during a state of emergency declared by the governor and for 2 years afterwards. The sponsor said at the public hearing that he put this bill in for St. Joseph Hospital when their ratio of income to debt service was out of line. And they received federal funds, so they didn't need to go through the auditing process, but he kept the bill in case other hospitals needed it. So this is so totally out of my wheelhouse. I reached out to Terry Hayes, who is the executive director of the Bond Bank, which includes, she's also the executive director of the Maine Health and Higher Educational Facilities Authority. There's a way to say that as the acronym, but I haven't figured it out yet. So I'm not going to read every word here, but she did reach out to the lawyers and their National Bond Council. And she said that some of the required financial reports are dictated by federal law and regulations. And as the Securities and Exchange Commission regulates the municipal bond market, and that any of these changes would need to come at the federal level. And that organizations that participate in the moral obligation program of MHIFA have committed to a variety of financial disclosures that occur throughout the terms of their loans. Many of these notes are for 20 years or more, and that they have made commitments to the bond holders at the time that the bonds were sold or purchased. And these commitments include various points of financial disclosure over the life of the bonds. And seeking to change those commitments via legislative action would result in significantly devaluing all of the bonds that are currently outstanding at MHIFA, which are more than $348 million worth, as well as making it nearly impossible to sell similar bonds in the future. She cites the state law that says that the state will not limit, alter, restrict, or impair the rights hereby vested in the authority in participating healthcare facilities, the participating institutions for higher education, and the participating institutions providing an educational program. And you can see what she has bolded there. And that in addition, the authority has not been informed by any of its borrowers that requiring the ongoing financial reporting creates a hardship, and that if a borrower were to bring this to the authority's attention, staff would assist the borrower to meet its reporting obligations. I know everybody likes it when I say this. I only get to do it very rarely, but you can't do this.
Representative Zager.
I may not know a lot, Mr. Chair, but I know that this doesn't seem like a very good bill. I move ought not to pass.
I would second that.
There ought not to pass. Motion has been made and seconded. Is there any additional conversation about something we can't do? So we'll ask Ms. Withy to run the vote.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
Yes.
Representative Lemlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci, Senator Baldacci is absent. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan, Representative Madigan is absent. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 11 yes, 2 absent.
Anna, is there anything else we're supposed to do this afternoon?
No, although I do believe that Kerry is going to collect the votes from Representative Stover that she missed.
Okay. Do you want to do, before we do that though, I want to call people's attentions because we don't all have to stay here. The reason we were able to do these extra 9 bills this afternoon was because of the incredible flexibility and willingness to make it happen from Aaron and Anna. And that should not go unacknowledged. And it makes it for a much better day for tomorrow. So thank you very much for those efforts. So I guess I will stay and Representative Stover and Carrie and I can record some votes. Have a good afternoon. We'll see everybody at 9 o'clock in the morning.
See, that wasn't so bad, Senator Claxton.
No, you win, Senator Moore, as always.
Good night.
Good night. All right. So Holly, did you want to record some votes?
Yeah, I'd love to.
So first is LD 1344.
And that is, can you just tell me how the vote went?
The motion was ought to pass as amended. And the current vote stands at.
Oh, yes, that's fine. I just need to know what the motion was.
Okay.
And
LD 1147, the motion was ought to pass as amended.
yes. And I was here for 1263.
Let me just go through all of them. And I think those are the only 2 you missed. Yes.
I had a little
Thank
work
you.
emergency. Okay,
Very good.
thank you.
Okay. Thanks, everybody.
Have a great evening.